Good morning, everyone. We are thrilled to welcome all the panelists and the attendees for the second Doctors for Clean Air Conclave, Doctors for Clean Air Conclave 2022. The Doctors for Clean Air Conclave 2022 is being organized on the occasion of Third International Day for Clean Air for Blue Skies. International Day of Clean Air for Blue Skies was passed as a UN resolution to be celebrated to create awareness about the importance of clean air for health. This version of Doctors for Clean Air Conclave is being organized in participation in partnership with National Center for Disease Control, Ministry of Health, and 9 leading medical associations from India and abroad. We are thrilled to welcome all the participants and attendees. Before we start, I'm just going to give a quick overview of Lung Care Foundation, and after which I will pass to Dr. Arvind Kumar to give an overview of Doctors for Clean Air. Lung Care Foundation is a not-for-profit organization that was started in 2015 with the objective of care and cure of 2.6 billion lungs in India. We wish to do this through awareness, research, and clinical care. Since the foundation has started, we have reached over 70 million individuals through video. We have trained over 150,000 individuals on various issues related to lung health. We have had over 600 plus media articles, worked with over 50 partner organizations, trained over 100,000 youth volunteers, distributed over 80,000 medicinal kits across India during COVID-19, in partnership with Government of India, made over 100,000 schools asthma aware by distributing an asthma manual for schools, and led 4 research studies. The work of Lung Care Foundation has been appreciated by the current Prime Minister of India and the former President of India. Without spending any further time, I would now like to introduce Dr. Arvind Kumar. Dr. Arvind Kumar is the founder trustee of Lung Care Foundation and chairman Institute of Chest Surgery at Medanta, Gurgaon. Dr. Arvind.
Thank you, Abhishek. And ladies and gentlemen, once again, a very, very warm welcome to all of you. I would like to say good morning, good afternoon, as well as good evening, depending on which part of the world you are joining from. 2 of our esteemed panelist presidents are joining from Europe. So a very warm, early good morning to both of you. The flow is that in the beginning, next couple of minutes, I would quickly take you through the details of the Doctors for Clean Air as to why this was started, what we have achieved till now, and how all of you, ladies and gentlemen, can become a part of this and lead the fight against air pollution. So it's an initiative by Lung Care Foundation and Healthcare Without Harm. It's a network of passionate and informed doctors who wish to take part in the fight against air pollution and climate change in India. And of course, now with the participation of FIGO, I think we will be replacing this word with globe, climate change in globe. The key objectives are 3. Awareness amongst doctors and public at large. Number 1, the awareness will lead to awakening amongst these people for faster action, and that action ultimately will, by the citizens as well as policymakers, will lead to air becoming clean for all of us. Why are we talking about doctors being the lead advocates for clean air? The reasons are that we, in our day-to-day practice, every day, all of us are seeing patients who have been impacted by air pollution, and we see the horrible damage caused by air pollution firsthand. and that horrible experience in our OPDs motivates us to do something about it. So we are motivated individuals. On the other hand, we have a position of respect and influence in the society. So when we talk to people about it, they get motivated. So we are motivated motivators. This organization was started on December 4, 2018, when we had 40 senior doctors from across the country, a wide array of specialists, and presidents of 12 leading national medical associations in the presence of Miss Christiana Figueres, a well-known personality globally in the field of fight against air pollution. This was launched. So since this was conceptualized in 18 October, realized in December 18, during 2019, we had launches in 6 states across the country. And in February 2020, when we were struck by COVID, we didn't get deterred. We had a Zoom program, a unique 7-hour continuous program where 6 medical associations did a complete 1-hour program involving their members to highlight the health impacts of air pollution. Thereafter, the Doctors for Clean Air went into community research. We did research among school children in Delhi and other parts of the country, and that research found publication in a very esteemed journal, Lung India, during early part of this year. And the impact that we have made. So today, the Doctors for Clean Air has chapters across 8 states in India. We have 43 senior doctors and presidents of various associations as our clean air lead champions. 21 national medical associations have committed to work for clean air. We've done 3 network-driven research studies which have impacted decisions even in the court. The total reach is over 250,000 doctors through the various associations who are part of this program. And during the COVID period, when everybody was in-house, we did over 60 online, offline training programs where we trained over 3,000 doctors, 2,200 medical students. We reached out to 2,300 plus college and school students who we think are very, very important in this fight, and thousands of citizens were engaged in the fight. We have over 60 million social media reach, and the most important was that the studies which we carried out actually led to 2 key court judgments where our studies was quoted. So this is the study we did in 1,100 school children in Delhi, where we did an on-site pulmonary function test and compared their function test with those of children in less polluted areas. And friends, you will be shocked to know that we found 29.3% incidence of adolescent school children in Delhi were found to have asthma or airflow obstruction based on PFT studies. 39.8% of the school children from Delhi were obese or overweight. And for the first time from India, we reported an association between asthma and obesity. So air pollution was acting by twin pathways. It was causing asthma directly and causing obesity, which also was contributing. The Supreme Court gave a landmark judgment against firecrackers last year, and we were present in the court to depose there, and it was quoted in the judgment also the statements given by Doctors for Clean Air representative. Similarly, the National Green Tribunal took notice of our research studies and quoted the research study in one of their recent judgments. We have hundreds of articles in newspapers. We have been covered by every possible national and international news channel and newspapers, from New York Times, Washington Post to BBC, National Geographic, Reuters. The Doctors for Clean Air voice is not only heard nationally, but also internationally. As I said, from Indian Medical Association, FOXY, Pediatrics, Chest Society, Association of Surgeons of India, Preventive and Social Medicine, Medical Students Association, Neurology, Public Health Association, PSM, Anesthesia, Physicians, Urological Society, Cardiological Society, Radiological Society. Almost every possible discipline is represented in now as a partner for DFCA. And we have a website called dfca.org, Doctors for Clean Air, dfca.org, where we have put lot of resources for doctors to use. So if you go to the website, there is a view resources column. And if you click there, what is the basic onboarding guide, air pollution 101, the basics of air pollution, what doctors can do, health impacts of air pollution, all these studies are available for a free download. We also have made posters specific to impact of air pollution on different organ system, whether it is lungs, cardiovascular system, neurological system, pregnancy, children, and these posters are all available at the DFCA website for a free download. Friends, we have a complete dedicated staff in our office. We have Dr. Mitali Raja, who's the program head, Dr. Carmen, who's the program manager, and Mr. Hamid, who is the network manager. They are available 24/7 to help all of you supply with any and every material that you might need when you start working in this area. We'll be sharing their contact details during the program, and you are welcome to reach out to them for any resource that you might need at any point of time. So I take this opportunity to request all of you to kindly spread this word about this passionate doctors network called Doctors for Clean Air and Climate Action. Join it and contribute to making air cleaner for our future generations. With that introduction about Doctors for Clean Air, now it's my proud privilege to introduce my fellow welcome note speaker, Professor Akash Srivastav. Dr. Srivastav is a health professional with over 30 years of experience in this field. He is presently the Additional Director and Head, Center for Environmental Health and Occupational Health, Climate Change and Health at National Center for Disease Control, New Delhi, which is a body under the Ministry of Health, Government of India. And the center is currently the technical agency for implementation of the ministry's Health's National Program on Climate Change and Human Health under the National Health Mission umbrella. Prior to joining NCDC, Dr. Srivastav has served organizations like ICMR, Indian Armed Forces, and UNICEF. Dr. Akash, it's a pleasure for me to hand over the mic to you. Over to you, sir.
Thank you, Dr. Arvind Kumar, for the introduction. And good morning, everyone, and welcome to all of you to this Clean Air Conclave 2022 in a run-up to the International Day for Clean Air for Blue Skies on the 7th of September of this year, being co-organized by stakeholders, the National Program on Climate Change and Human Health, Ministry of Health and Family Welfare, Lung Care Foundation, Doctor for Clean Air and Climate Action, prominent associations of medical and surgical specialties, and also other important organizations, to name a few. The National Program on Climate Change and Human Health is one of the new programs that has been initiated by the Ministry of Health and Family Welfare to address the issues of climate change on health as well as environmental concerns. This is probably the first program that on this large scale is established all across in all states and districts of the country, and would for the first time be addressing issues of environmental health concerns. The program as of now addresses issue of subjects like air pollution through awareness drives, through developing the capacity of health workforce, and also trying to make health sector resilient through preparedness. That is providing for early warning signs to the health systems, as well as setting up a surveillance systems of illnesses that are on account of air pollution and other environmental regions. It also works along with the Indian Council of Medical Research in issues of research related to air pollution and other environmental conditions. We today have an audience of the clinicians from all over the country, both private sector and public sector, who will be giving and showing their solidarity to the cause of air pollution and health in India today. I am hopeful we will all benefit from the guest talks, from the keynote addresses, and the panel discussion that we have lined up today, and also the success stories that we will hear from certain champions from different states on air pollution related issues. They have taken out their precious time to be with us today, and we will all find it hopefully useful. I urge the clinicians to pledge today to the cause of air pollution and bring to practice the recognition of air pollution as a factor for health related outcomes. When you see in your patients, either in history taking, in taking case notes, or prescription of do's and don'ts, and counseling the patients about how to protect their own health. As a voice that holds dignity, respect, and weight in the society, I request you to contribute to raise awareness of this risk factor in your academics, in your teaching, in your research, in your clinical practice, and in the social reach that you have, as this would make a difference into how the country looks into this menace and addresses it. I wish you all a wonderful day ahead, and over to moderator to invite the next guest speaker for today. Thank you.
Thank you very much, Dr. Akash Srivastav. I must mention here that being joined by NCDC and Dr. Akash Srivastav and Dr. Rameshwar being the lead participants on behalf of NCDC, we at DFCA consider it to be a singular honor, and we look forward to achieving much more with your partnership, sirs, than we have achieved till now. Thank you very much for your support, and we look forward to your working together with you. Moving ahead with the program, we all know the health ill effects of air pollution, but it's important to do a quick recap of how this damages every organ of our body from head to toe. And it's my proud privilege to introduce someone who actually is like an iconic figure in the field of health impacts of air pollution, Professor Sandeep Salvi. He is a pulmonologist from the city of Pune, one of the most accomplished pulmonologists who's been cited most number of times across the globe. He is presently Director, Pulmocare Research and Education Foundation, Pune, Member Steering Committee on Air Pollution and Health, Ministry of Health and Family Welfare, Government of India, and also the President-elect of the Indian Chest Society, who will be taking over the association a month later. And he's presently in Barcelona, taking part in European Respiratory Society meeting. It's my pleasure to invite Professor Salvi for his presentation on health impacts of air pollution, what we know today. Over to you, Professor Salvi.
Thank you very much, Dr. Arvind Kumar, for those very kind words of welcome and introduction. I feel very honored and privileged to be a part of this excellent initiative, the Doctors for Clean Air, set up by Dr. Arvind Kumar. What a wonderful program we have today. I would like to congratulate them for putting such a wonderful scientific, not only a scientific program, but a program that not only inspires, but also shows a way forward for how we can do something about the impacts of air pollution. The quality of air that we breathe is absolutely vital for our survival. And the reason for that is the air that we breathe nourishes our body with oxygen that generates 90% of the body's energy. And therefore, the quality of air that you breathe is absolutely essential, not only for your survival, but also for your good health. India is one of the most polluted countries in the world. If you look at the heat map that I have just shown, 95% of the people residing in India live in areas where the air pollution levels are higher than what has been recommended by the World Health Organization. The green colors that represent clean air are very far and few across the entire map of India. Most of it is yellow, brown, and some of it is even red, showcasing the different levels of air pollution that we have in different parts of our country. One of the biggest impacts of air pollution on health is it causes death. It causes excess death than what it should have done. It has been estimated that air pollution kills 3 times more people than those who suffer from HIV, AIDS, tuberculosis, or malaria, all put together. And this map that I have shown you highlights where India stands in terms of exposure to different pollutants, not only air, but even water and other air pollutants compared to the other countries in the world. So India stands out as the country that has the highest amount of air pollution. It has been estimated, according to some recent figures, that 1.24 million people die every year in India because of exposure to air pollution. Our life expectancy, which has now grown significantly over the last 75 years since our independence to about 69, we still lose a significant amount of our survival years because of the pollution that we breathe. In some parts of the country, an estimated 2 to 5 years is lost because of the high levels of air pollution that people are exposed to. And a very interesting recent report has suggested that India loses a staggering 95 billion US dollars, or that is equivalent to 7 lakh crore, due to reduced productivity, work absenteeism, and premature deaths associated with air pollution. And that is about 3% of our GDP. So that is the scale and the extent of impact that air pollution has on our country. Air pollution not only affects the lungs, it affects every single organ of the body. And this slide, this cartoon that I've shown on the right-hand side, depicts the different organs that are associated with air pollution. Lung diseases that include infection or even chronic non-communicable diseases such as asthma and COPD are one of the common effects of exposure to air pollution. But heart disease, be it ischemic heart disease, be it hypertension, be it congestive heart failure, are all very strongly associated with exposure to air pollution. Then we have stroke, diabetes, all sorts of cancers, including lung cancer, that are strongly associated with exposure to high levels of air pollution. The harmful effects of air pollution start even before we are born. And this is a very important study that has been reported from the city of New York, where 10 newborn babies were randomly selected as soon as they were born. And after the umbilical cord was cut, they collected the blood from the umbilical cord and sent it to the laboratory to look for presence of circulating air pollutants. And what they found was quite shocking. 287 different types of pollutants were identified in the umbilical cord blood of these babies who were just born in the city of New York, clearly highlighting the fact that pregnant mothers, they pass on the polluted air that they breathe to their growing fetus. And that's where the exposure to air pollution starts, in the growing fetus. During pregnancy, the health effects of air pollution have been very recently highlighted in several original papers and review articles. Gestational hypertension, gestational diabetes, preeclampsia, anxiety, depression associated with pregnancy have all been very strongly associated with exposure to air pollution. And this is now becoming a very important risk factor for all pregnancy-related issues. Not only that, but the baby that is being born in the uterus of the mother, the baby is exposed to air pollution. And this has been shown to have a significant impact on the growth of the baby, which lasts for an entire lifetime after it is born. Congenital anomalies such as cleft lip, cleft palate, neural tube defects have been recently shown to be associated with exposure to air pollution by the mother. Premature deaths are also extremely common in polluted cities. The picture that you see on the top left, day 1, day 2, and day 5, are artificial lungs that were put on the roll of a city in city in Lucknow, in Uttar Pradesh, to simulate what happens when we are breathing. So these were artificial lungs, which were white in color to start with, and just over a period of 1 day to 5 days, you can see how black it gets. Now that is because of the quality of air that is present. And if these artificial lungs become so black, you can only imagine how black our lungs must be becoming because of chronic exposure over the years to the high levels of air pollutants. Lung growth in children has been shown to be significantly affected because of the quality of air that they breathe. So if you look at the lung growth of a child from India versus the lung growth of child from Western countries, you can see the red line over here that represents what happens in India. Our lungs are smaller as compared to those who are born in cleaner countries. Not only the lungs poorly developed, but even the total body height has been shown to be reduced due to exposure to air pollution. The lungs of healthy people living in India have been shown to be 30% lower as compared to the lungs from people who live in cleaner cities and towns across in the Western world. So our lungs are perhaps the most unhealthiest among all the people living on this planet, including people from Southeast Asia, East Asia, Sub-Saharan Africa, South Asia, and all that. Indians have the weakest lungs across the entire world. Children, when they grow up, they are exposed to air pollution, and this has been shown to have a significant impact on the risk of developing respiratory tract infections. In fact, 50% of childhood pneumonias under the age of 5 have been attributed to indoor air pollution. But this recent systematic review of 35 developing countries show that it's even the ambient air pollution that is present in the cities and towns that are associated with an increased risk of developing childhood respiratory tract infections. Boys are more affected, younger children are more affected, and those living in the rural areas seem to be more affected, not only because of the ambient air pollution, but because also of the accompanying indoor air pollution due to the burning of biomass. So clearly this is affecting the growth of our children. As Dr. Arvind Kumar alluded in his inaugural talk about the Delhi study, where we compared the prevalence of respiratory symptoms in Delhi children versus those living in cleaner cities such as Kottayam and Mysuru in southern part of India. 3,000 plus children, adolescent aged, underwent a questionnaire as well as a spirometry. And this is what we found about allergic diseases. So look at the blue bars that represent children from Delhi versus the orange bars that represent children from Kottayam and Mysuru. There's a startling difference between children who live in a polluted city like Delhi versus those who live in cleaner cities. So the impact of allergic rhinitis, allergic eczema, asthma is very high. John Brostock, who first described allergic rhinitis 300 years ago, it took him 9 years to collect a total of 28 cases of allergic rhinitis. Today, the prevalence of allergic rhinitis in Delhi children is around 25%. Every fourth child in Delhi seems to be suffering from allergic rhinitis, and a significant component of that is because of exposure to air pollution. Dr. Arvind Kumar also highlighted the prevalence of asthma in these adolescent children. 29.4% children in Delhi showed spirometrical evidence of obstructed airway disease that implies asthma. And he also highlighted the association between air pollution, obesity, and asthma. Air pollution causes obesity. So it's not only the quality of food that we breathe, that we eat, or the lack of exercise. The quality of air that we breathe has a significant impact on the hormones of the growing boys, and that has been shown to be associated with obesity. So obesity is not only a diet-related issue, but it is also a quality of air-related issue. So air pollution affects not only the respiratory system, it affects the growing fetus, it affects the heart, it affects the vascular system, it affects the endocrine system, affects the brain, and affects the reproductive system. And I've just highlighted this new observation that we made in India, that air pollution is also associated with obesity, that further increases the risk of developing asthma. Our mother planet has now been realized to be a living organism. So the earth on which we live is a living planet. Just like how we are living organisms, the earth is also a living organism. And the impact of the pollutants that we produce on our mother earth has been staggering. Air pollution has given rise to climate change and global warming. And this global warming has created catastrophic events on the lives of many, many people. So clearly, air pollution has not only had an effect on our health, but also on the health of our planet. And that indirectly is also contributing to the worsening health status that we have. So it is with this very brief and quick introduction to the impacts of air pollution and health, I will stop over here and I will pass it on to Dr. Arvind Kumar for the subsequent sessions. Thank you.
Thank you very much, Professor Salvi. That was a very quick but very impactful presentation on the array of health impacts of air pollution. And the saddest part is air pollution does not wait for us to be born to start impacting. It starts hitting us even before we are born. I think this is one simple message which probably needs to reach 700 billion people on this planet, that even before we come out into this world, air pollution is hurting us. Such is its impact, and it affects every organ from head to toe. Thank you very much, Professor Salvi. With that, we move to a very unique presidential session now. Ladies and gentlemen, it's indeed my honor to be moderating this session where the honorable, respected presidents of 9 associations in the country, 8 associations in the country, and an international association, FIGO, they are here not to tell us about the impacts of air pollution on their organs, which has already been covered by Professor Salvi, but moving ahead, we know that it's hurting us, it's hurting our children. Now, as very powerful associations with thousands of members spread across the country, how can these associations play a role in achieving the clean air? So I have a very difficult task now of managing 9 honorable senior presidents representing 9 associations. We have made a slight change. Actually, our international guest, Professor Jean from FIGO, was supposed to be the opening person, but the president of IMA has just called us that he's actually invited by the vice president for some meeting. So he has requested if he can be. So with the kind permission of Professor Jean, may I slightly change the order and request the IMA president? Do I have your permission, Professor Jean?
Of course, of course.
Thank you
I look
so
forward
much.
to
That's
it.
so kind of you.
Thank
So
you.
friends, the pattern I'm going to follow, that since we have 9 associations, I will be briefly mentioning about the association and its reach in 2 or 3 lines, and then in just 2 or 3 lines introducing the respected presidents. I must say each of the 9 presidents is actually a unique person with highest levels of achievement. And if I was to read out their detailed biodata, we'll probably be reaching the end of the program. For the sake of brevity, I'll use 2 lines to introduce the association and 2 lines to introduce the president, and then hand over to the president for their nano keynote address. So as an opening batsman, it's my privilege to introduce the Indian Medical Association. Friends, the Indian Medical Association was started in 1928 on the occasion of the 5th All India Intermedical Conference at Kolkata, with the objectives of promotion and advancement of medical and allied sciences, improvement of public health, medical education, and to preserve the honor and dignity of medical profession. It has over 350,000 members spread across country and operates in 34 states and union territories through over 1,750 branches across the country. And it's again my honor to introduce Professor Sahajanand Prasad Singh, who's the current president of Indian Medical Association. Dr. Singh is one of the leading and senior most surgeons in the country who is practicing in the city of Patna. He is known for his exemplary surgical services and, more importantly, the social ramifications, having compassion towards the underprivileged sections of the society. And for his services, he was awarded the prestigious Dr. B.C. Roy National Award in 2017 for outstanding services in the field of socio-medical relief. It's my honor to hand over the dais or the stage or the platform to Dr. Sahajanand Prasad Singh, current National President, Indian Medical Association.
Thank you very much, Dr. Arvind Kumar ji. Dear Arvind Kumar, founder and managing trustee, Lung Care Foundation, and doctors of Clean Air, London speaker, dignitaries of DAS, and participants. I am delighted to be here for the Doctors for Clean Air Conclave 2022, discussing issue on health impact in air pollution. Air pollution is a global public health emergency, causing severe harm to most body organs. India is the second most polluted country in the world. Around 16.7 lakhs deaths in India were attributable to air pollution, accounting for 17.8% of the total death in the country in 2019. Achieving clean air is a collective responsibility of the citizens and a priority of the prosperous and healthy India. Doctors can play a vital role in creating awareness about the health impact of air pollution and advocating for a stricter and the quicker action for clean air. Recognizing the urgent need to address for air pollution, Indian medical associations had organized an international summit on air pollution in 2017, wherein the respectively more World Association, Japan Medical Association, Canadian Medical Associations, Bangladesh Association, the state branches of the Indian Medical Associations delivered a detailed the international and Indian scenario on air pollution. The summit was also addressed by representative of Pollution Control Board of different states, Minister of Health and Family Welfare, judicial expert, environmental and media professionals, and civil society. On the basis of the long deliberation in IMA issued an advisory on air pollution, which highlighted that the long-term exposure on PM 2.5 increases the risk of heart disease in addition to chronic pulmonary disease. I am sure today webinar will focus on the action to the taken by the government as well as the public in maintaining the clean air and minimizing the air pollution. I am thankful for the organizer for giving me an opportunity to share my views. Thank you very much, sir. Thank you.
Thank you very much, Dr. Sehjanand. May I take?
Dr. Arvind Kumar, your block.
Am I audible now?
Now you're audible. Yes.
Okay. Dr. Sehjanand, thank you so much, sir. Sir, you represent the largest medical association in the country with over 350,000 members spread across the country. So may I take this opportunity to request you for a couple of actions. For example, we have a slide set which has been made on the health impacts of air pollution, and maybe this could be put on the website of the IMA and could also be shared with all the members of IMA across the country, which would actually make them aware, because although they know that yes, it's impacting, but I think the gravity of situation has not really touched them. And I think that will be a big service we can do to the society. Your thoughts on that, sir?
I will do, sir. I will do everything what you were told just now. Today I will done. Okay.
That's very kind of you, sir.
Sir,
and thank you very much for joining us despite your schedule. I know you've been invited by the Vice President for some program on organ donation, and I can see you're joining us from the car. So thank you so much for your time. And we will be in touch with you for sharing this information with all the members of IMA. Thank you, sir. Have a wonderful day, sir. Now it's a singular honor for me to introduce FIGO and its illustrious president. FIGO, or International Federation of Gynecology and Obstetrics, is a global NGO working to improve the health and well-being of women and newborns worldwide. It was founded in 1954 by representatives from 42 national OBGYN member society. But today, from 42, that number has grown to 132 countries. That's nearly 2/3 of the member countries of United Nations. And it remains the only organization which brings together professional societies of obstetricians and gynecologists for research, advocacy, and best clinical practice. Professor Jean Ann Connery, MD, PhD, is the current international president of FIGO. She is an obstetrician and gynecologist with over 40 years of clinical experience and has recently retired from the OBGYN practice from Kaiser Permanente in Northern California. But more important than that is the fact that she's president of the Environmental Health Leadership Foundation and also serves on the USA Health and Human Services Committee on Infant Mortality. And as the current president of FIGO, she has a reach across 132 countries. Professor Jean, it's indeed an honor for all of us to be listening to your thoughts on how doctors can lead the fight against air pollution globally. Over to you, ma'am.
Dr. Arvind Kumar, thank you so much for a very kind introduction and remarks. Distinguished colleagues and my very own FIGO trustee and FOGSI president, Dr. Shanta Kumari, for recommending that I be here today. Let me see if I can successfully share my screen just to put up a couple slides. And can you see this all right?
Yes, we can.
Perfect, perfect. I just want to point out that coming as an OBGYN, I believe that OBGYNs have to be leaders in environmental issues, and particularly around climate change and air pollution. I will be brief. I gave my first lecture in India about 6 years ago about the environment. And when I was asked, I said, the first thing we need to do is look at the air pollution because it impacts, as Dr. Salvi so eloquently said, endocrine disruptors, multi-organ systems, and babies are born pre-polluted. So you can't say it more effectively than that. We see that women, especially pregnant women, are populations of concern, especially when it comes to climate change. They simply cannot move effectively when storms happen, when air pollution is taking place. In fact, I had one physician point out that death rates from disasters are 4-fold higher in under-resourced countries. And we've said that women and children are 14 times more likely to die than men in a natural disaster. Migration movement are risky. They're changing distributions of pollutants, whether it's mercury, lead, organophosphates, or other toxic substances. They will impact health and have an adverse effect on pregnancy. And as I will point out, increased temperatures impact fetal weight, gestational hypertension. But I do want to point out what FIGO is doing and what OBGYNs are doing around the world. Our first publication on this came out in 2015, where we effectively said, babies are born pre-polluted. We wanted to look at the reproductive health impacts of exposure to toxic environmental chemicals. And we were the first international organization to point out the impact on women's health. It is the air we breathe, the water we consume, the food we eat, and the products that we use impact our health and the health of future generations, simply because what a woman is taking when she is pregnant impacts a fetus and impacts future generations. Just last fall, FIGO released a really very important document on climate change, women's health, and the role of obstetricians and gynecologists in leadership, and took apart every aspect of the discussion: reproductive health, fertility, effect on pregnancy, so that our physicians would understand why we're dealing with the science behind this. Because as you said, Dr. Kumar, too often physicians talk about the science and don't believe we need to be advocates. And just now, this article on reproductive medicine in the face of climate change calls for prevention through leadership. As I've said, there are many effects of climate change and air pollution on health, climate change on fertility, prenatal outcomes, sexual health, reproductive rights, and survival. And I'll only mention air pollution here because we've already heard from Dr. Salvi that periconception exposure to air pollution increases the risk of congenital malformations. There's an association with preterm birth weight and stillbirth. And in the largest study to date, 33 million births, we can effectively say that air pollution is associated with preterm birth and low birth weight infants. So very conclusive study looking at 33 million births in the United States. But we know we can have an impact. In California, when coal and oil plants in California were retired, we looked at the preterm birth rate for the decade before that and the preterm birth rate for the decade after, and saw that we could reduce preterm birth simply by closing some of these plants and decreasing air pollution. So advocacy can have an effect. And for women, you understand that we cannot move. From the part of California where the fires happen, this shows that preterm birth is impacted by the smoke and wildfires that we're seeing. So again, air pollution. 50% of pregnancies are surprises. So just telling a woman to plan her pregnancy for the least polluted time of the year doesn't happen. So what can we do? We can educate, advocate, and do more research. FIGO has 4 pillars: educating our clinicians, research, interpretation, and implementation, advocacy, so we can be spokesperson for what has to happen, and then building stronger health systems. We have a committee on climate change and toxic environmental exposures. We provide webinars for our leaders. We have infographics on, very much like the infographics, your stupendous infographics you showed at the beginning. And we have issued statements on how to mitigate the impact of climate change. And as we say, saving our planet and lifting people from poverty, advancing economic growth, these are one and the same fight, and we must connect the dots between climate change, water scarcity, energy, global health, food security, and women's empowerment. Solutions for one are the solutions for all. Thank you so much for allowing me to be part of this.
Well, Professor Jean, I am actually left wordless. It's so heartening to know that although we are talking about it today, but way back in 2015, the FIGO had brought out that landmark paper. And since then, you've been highlighting consistently about the problems caused by this, including your landmark papers in 2021 and 22. And I would just like to reiterate and re-quote 2 lines from your last slide. If not us, then whom? I think these 5 words probably summarize the ethos of today's meeting of Doctors for Clean Air. If not us, then whom? Very aptly said, Professor Jean, and it's indeed an honor now that you are part of this doctors network, and we look forward to working in this field together, complementing each other's resources. Thank you once again, Professor Jean and Connery. Thank you.
Thank you.
Now, ladies and gentlemen, we move from FIGO to our society nationally, the Federation of Obstetrical and Gynecological Societies of India, or FOGSI. It's a professional organization representing practitioners of OB/GYN in India, with over 262 member societies and close to 40,000 individuals across the length and breadth of the country. It's probably one of the largest membership-based organizations of specialized professionals. And like FIGO, FOGSI also has been very active in highlighting the health impact. And it's led by a dynamic person, Professor Shanta Kumari. Why I say dynamic? Because last 10 days that I have been in touch with her to arrange for this program, every day that I called her, she was in a different city. When I called up last night to check about whether she has received the link or not, she said, I've just landed in Mumbai for a 2-hour meeting and will be catching the early morning flight to Cochin and will be joining from there. She is a senior gynecologist and obstetrician practicing at Yashoda Hospitals, Hyderabad, over 40 years of experience. She has been she is a treasurer at FIGO for 21-23 term, and she's currently the president of FOGSI for 21-22 term. Professor Shanta Kumari, thank you very much for not only consenting to be here, but also for bringing Professor Jean to be part of this presentation. Over to you, madam.
Good morning, everyone. Thank you, Dr. Arvind Kumar. In fact, when you called me about this meeting, I realized it was so very important that we have FIGO on board. I bring greetings from FOGSI and FIGO. As said, yes, we are a 38,000 strong body of OB-GYNs with 262 societies across the length and breadth of the country. Now, how the environment is affecting and how we as the doctors are going to influence the society at large to look at this has been so well clearly mentioned by the presentations we have just heard. You have just heard how FIGO, our international organization, has been working to show that effect of environmental change on pregnancy. Now, we care for the women. We are the first point of contact for women, and we are influencers. Women look up to us as the people who can actually guide them. And that is the reason I feel as obstetricians, gynecologists, we should focus on our role in trying to bring about a change in the society we live, the people who are there, because every single aspect of what has been taught has been affecting women's health. And how is it? because it's affecting the pregnant women. It is affecting the generation next. What is the use of becoming the best of economy? I just read yesterday that we have, even when you look at the economy, Indian economy has beaten United Kingdom's economy. Yes, we're doing very well on this front, but as we have seen now, we see that we are one of the most polluted countries in the world. Now, at what cost? I think that is very important. And if we can make our members aware of this issue, and if all our members start talking about it, probably in the times to come, everyone will realize the importance of this. Now, I'm not having any presentation. I just want to share the screen with one small video, which I wanted to show you all.
You could just go to share screen.
Yeah.
And click the video.
Click the video. Can you see it?
No.
Is the video seen now?
No, madam. Your screen is shared, but the video is not coming.
Okay. I think there's been some issue. Yeah.
Yes.
Now, when I took over as the president of Foxy, in the theme of this year was, I thought we should use all the 5 elements of nature. Because all these 5 elements, the air, the water, the earth, and the fire, these are the ones which make Sri Shakti. These are the ones which contribute to the health of the woman. That was the reason why we actually came out with this idea of this logo, where we actually incorporate the nature in our theme. And that will actually focus on how very important the environment is in women's health. That was the reason, like with the theme of the year is Foxy for All Always and Dhira Stop Violence Against Women. We have seen to it that we talk about the environmental health. You've just heard my president, Jean Connery, who has shared her thoughts about environmental health. So nationally and internationally, every one of us are focusing on this. And I'm sure that all the voices together will definitely make a difference in making everyone realize that each one of us will matter. Each one of us are leaders in our own respect. It's not only Dr. Arvind Kumar or Dr. Sajananda Prasad or anyone who is a leader. It is each and every doctor of each and every association who are going to be a leader. That's what Jean has told. There's a leadership initiative where we need to create more leaders to bring about a change. I'm sure that this very important forum on clean air will make a difference, and together we can try to bring a change. Last month I was actually in Europe, and I was so shocked. I was in Paris, followed by Geneva. I'm from Hyderabad. So Hyderabad, the temperature is very, very hot. So we are used to a hot temperature. But I was surprised there in European countries where we usually think it's so cool and pleasant. It was actually even worse than India. So what is it that we are actually going to? So these are very important for everyone to sit back and think what it is that we are going to contribute to the Mother Earth. So thank you very much, Dr. Arvind Kumar, for having us here. And I'm in Cochin. I have to leave for a CME in another 5 minutes. So thank you very much for having me.
Well, thank you very much, Professor Shanta Kumari. That was a very important presentation, and I really like this idea of a logo incorporating the 5 elements that our life is based on. And if we can pay attention to these 5 elements, and I think a lot of diseases will get taken care of. I think the most important thing is for all of us to accept that air pollution is the biggest existential threat to human race today. And first thing is for all of us to believe that, yes, it is a serious matter. And when all of us doctors accept that and believe in that, then only we will be able to start motivating our members and then members of the society to do something about it, because the time is running out fast. If we don't act fast, we probably will have to regret. Thank you very much.
Dr. Arvind, I will just tell you, we have zonal conferences. This year, the 4 zonal conferences, I gave the 4 elements. Yesterday, we had the East Zone conference. I said, your theme should be around the air. So you talk about the effect, and then one theme is around the water and the pollutants. And then you talk about the earth, the chemical pollutants which are happening, and the food which we eat are also contaminated with the pollutants. So I have given each of the zonal conferences one of these elements to focus for their conferences.
Sure.
To bring about this awareness.
Sure. Very well said, madam. That's exactly the request I made to IMA president also. We all have our regional conferences, state conferences, national conferences, and if we can just devote a 15, 20, 30 minutes time in each of those to continuously go on discussing this topic, to keep it in the focus, to keep it in the limelight, then I think a lot of purpose will be served. Thank you very much, Professor Shanta Kumari. We now move to our 4th association. Indian Academy of Pediatrics was established in 1963 at Mumbai. It is committed to the improvement of the health and well-being of children across the country. It has over 32,000 members across the country. It's well structured in 5 zones, having 30 state branches. It has promoted different specialties in the field of pediatrics through its 20 subspecialty chapters and 8 specialty groups. And today, representing Indian Academy of Pediatrics is a very eminent individual. Professor Harish K. Pemde is currently Director Professor of Pediatrics and Head of WHO Collaborating Center for Adolescent Health at Lady Hardinge Medical College, New Delhi. He is the General Secretary of Indian Academy of Pediatrics Medical Education Chapter, and as the Medical Education Chapter Secretary, he's been very instrumental in working on the topic of air pollution. More we will hear from Professor Harish Pemde. Over to you, Professor Harish.
Thank you, sir. Thank you for giving this opportunity to Indian Academy of Pediatrics. And Indian Academy of Pediatrics is close to 35,000 members across India. And we have presence in more than 250 Indian cities and some cities outside India also. And we have close to 30 sub-specialty groups and chapters in the Indian Academy of Pediatrics. This Environment and Child Health group was also started about 20 years ago in the Indian Academy of Pediatrics. And since then, we have been organizing various advocacy programs, awareness programs for our members and for community and society, and have been leading various advocacy issues, advocacy initiatives also. The vision of our Indian Academy of Pediatrics Environment and Child Health Group is to protect and promote the environment in order to protect children and to protect future adults of India. Friends, who better than pediatricians know about the bad effects of air or polluted air on the health of children? It is estimated that half of all the respiratory problems are linked to the poor air quality, whether this poor air quality exists in the environment or poor air quality which exists in the inside the house. Okay, so we know it very well about these effects. And friends, in future also we shall continue to do these efforts. In the forthcoming international conferences, one is happening in Asian Congress of Adolescent Health, where we are organizing one full session on climate change and its effect on adolescent health. We are also having a conference of International Pediatric Association next year in February. There a whole workshop will happen on the environment health issues. Today I want to say, or I want to put forth my opinion about the role of doctors in the fight against the pollution per se, and maybe most commonly with the poor air quality. Friends, I believe that the most important power which doctors have is their prescription. Lakhs of prescriptions are given every day in our country. 350,000 members of IMA and various associations we have here writing our prescription. Time has come, we should document the bad effect of pollution, or mainly the air pollution, on our prescription. If we write this thing that yes, this particular episode has been linked or which associated with poor air quality at your home or outside the home, I think this is going to give a very, very strong message to the public, to the policymaker, to all the stakeholders. And as a doctor, we should not miss this opportunity of documenting. Studies are okay. We have to do properly scientific studies and document the bad effects. But this effect, documentation of this kind of effect for individual patient is equally important, but I would feel that this will be much more powerful to document the effect of poor air quality in our country, and this will definitely go to the eyes and ears of our policymakers, and as a whole, collectively, we can have a better policy, better initiatives to clear our air. So friends, I appeal all associations, all doctors who are practicing, whether they are in government or in private, document that yes, your hypertension, your obesity, your asthma, your pneumonia, your preterm baby, maybe some contribution of bad air has been there. So please look for it, help us, and help as a collective initiative to clear the air in India. I will stop here with the commitment of Indian Academy of Pediatrics for to fight against the pollution, against the climate change, and to make aware our members and common public with the effects of this poor air, and whatever we can do, we shall be doing in the times to come. Thank you very much.
Thank you very much, Professor Harish. Pediatricians see children and gynecologists see mothers. These are two very, very important components through whom this message actually can be spread across the society. Of course, all other organs are important, but in terms of numbers, I think these are very too important. And thank you very much for highlighting that you have special sessions dedicated to discussing air pollution and climate change in your forthcoming national and international conference. And I wish you all the best, and we'll continue to be in touch with you for carrying out more studies on children across the country. Thank you, Professor Harish. Now we move to the next association. The order I'm moving is in terms of the membership strength. Now, Association of Surgeons of India was established in 1938 to realize a long-standing wish among the surgeons to get together for the purpose of sharing each other's experiences and enhancing each other's skills. Starting with 112 to begin with, today it is at 27,500 plus, an ever increasing membership number, with chapters in over 28 states and in 28 cities and union territories as individual chapters. And the association is represented by a very eminent individual and a friend of mine, Professor Siddesh. Professor Siddesh is a former professor and head of surgery from JSS Medical College, Mysore. He's a very senior endoscopic laparoscopic surgeon, but also an individual committed to the cause of air pollution. And 2 years back, when Lung Care Foundation and Doctors for Clean Air decided to do the study of the lung health of children, and we wanted to compare the lung health of children in Delhi, which is the polluted city, compare it with some of the less polluted cities in South, we chose Mysore, and Professor Siddesh was the lead person who connected us to various schools and facilitated that study, which is now published in Lung India. Over to you, Professor Siddesh. It's an honor to have you here, Professor Siddesh. Please unmute yourself. Siddesh, unmute yourself.
Okay, sorry.
Thank you.
Good morning, everybody, and thank you, my dear friend, Dr. Arvind Kumar, for making me a part of this very important program. I feel really proud and very happy that one of my past president of the Great Association of Surgeons of India has taken up this task of not only contributing to creating awareness at world at large, but also has contributed in a big way in bringing in policies and changing the system all over to bring in better world. So that is really very heartening to see. And today he has taken up, in addition to having been a founder of Lung Care Foundation, an association which is relentlessly working with the scientific work as well as helping to create policies in preventing lung injuries by various aspects. But also today he has taken up the task of forming this Doctors for Clean Air Conclave for 2022. I understand the agenda of this conclave has been to bring together the heads of the various very major organizations having thousands of members under his banners. And like Association Surgeons of India, Arvind, we have crossed 31,000, nearing to 31,000 membership. And with the associate membership of those who have already become members as postgraduate students with qualification, they're bound to become members, full members, would be additional 6,000. So that is a huge number itself. And I'm going by the number of the other associations which have just gone through. We as a group can make a very big doctors community. And that is what I'm sure Arvind is aiming at, to catch us and to make us contribute in creating awareness. Doctors as a group, we don't require to get aware about the ill effects of polluted air. We also don't require to be aware about the magnitude of the problem. We are all very much aware of these things, but also we also do have know about the solutions, what is required to do, but that is not important. Now we are all getting together today, how best we can use or promote our association and our membership at large to make them feel committed to create awareness among the society where we are associated with at the ground level. If each of small actions what we can make at our personal individual levels and at the capacity of whatever we are working at in various institutions, we can bring about small changes and become, doctors are treated as they look up, the society looks up to the actions which are done by the doctors. For example, being a person born on 5th of June, being the Environmental Day, I am an enthusiast environmentalist. I make sure that I plant saplings to the hundreds in each year on around 5th of June, being around the monsoon when it begins around in our area. So I have this year planted around 650 in my farm and also several public places. So there are certain small initiatives which each one of the doctors, if they take up, they can be taken as a module by this society who look up to you to copy as example. At the same time, doctors are the community which own the cars. We know doctors also intend to buy high-ended cars without realizing, many of us, that it guzzles up more fuel than what it is required to carry us from place to place. Just think about this. It is not that buying an electric vehicle, which I have made a resolution hereafter, or whatever vehicle I buy would be either a vehicle without the use of fossil fuel or a hybrid variety altogether. But whatever we do, that action may not bring out the change and say effectively, but that can spread the message in the society. Same way, we can create a logo, Doctors for Clean Air logo, which we can stick on our vehicles, stick in a prominent place in the work where we work, and show our commitment to this cause. So that goes in a way to create not only awareness, just to say what you can do from at your individual level to bring about this change. And next is what I think is bring about at least being committed as an association which is contributing to this cause, why not we hold one common program one particular day in the year, like taking out a awareness jata, or at least having a awareness program on a public platform in a mainstream media, or whichever way we can look at it, we can create awareness in a much bigger way, just like a World Cancer Day or something like that we can do. And I'm sure, I will assure you from my side, as the head of the Association Surgeons of India, our website will have a clear message has been put forward, and also will surely circulate the set of slides educating and bringing about more awareness among its members. And also, I wish to have a link put up on a website having various aspects of the injuries and changes which can be brought about, which can create clean air to our society. Again, I say, as an association, we do a lot of social service activities, but an activity also like this one will have a more bearing effect on a long-standing health change in the community. I'm sure whatever we do, even about 1/3 of our doctors take up this as a cause and do as little contribution, it's going to, in a long run, bring about a major change in the society. I believe that, and I hope by joining this conclave and trying to do some contribution as a group of association, we will hope to leave behind a better world to come up for our next generation with much clearer skies and much cleaner air. Thank you, Dr. Arvind, for giving me this opportunity to share some of my views. You can always feel free, as my elder brother and also a past president, to keep guiding how best association can take forward this cause which you have taken up so well committed. I really hats off to you at this same time. I congratulate you. Thank you very much. You are muted, Arvind.
Thank you, Professor Siddesh. Thank you very much for agreeing that the slides should be put up on the website. I think that's a humble request I would make to all the associations. We will be happy to share these common slides, which are very simple, easy to understand for everyone, even without a narration, which tell about the ill effect on every organ from pregnancy to elderly age. And I think sharing that, if over 600,000 doctors across the country could be shared that slide set, I think it will have a huge impact. Thank you, Professor Siddesh, for your thoughts. We'll be in touch with you. Next, in terms of numbers, I move to Indian Radiological and Imaging Association, which is a national level body with over 21,000 radiologists from all over the India, registered in the year 1937. Aims and objectives are directed towards continuous improvement of diagnostic standards in the country by informing the doctors about the latest developments in the field of radiology, imaging, and radiation medicine to stimulate research. And representing this association is its current national president, Professor Pushparaj Bhatele. Professor Pushparaj Bhatele is an alumnus of Medical College, Jabalpur, and now he works at the same medical college as principal radiologist and head of MRI center. More importantly, I would like to convey that when I spoke to him about joining in this program, the thoughts that he shared about what he intends to do were very, very stimulating. I will not share them with you. I will let Professor Pushparaj share those thoughts with you, and they are very different from what other associations have to say. Over to you, Professor Pushparaj Bhatele, President, IRIA.
Good morning to everybody. On behalf of 24,000, not 21, 24,000.
I stand corrected.
I feel honored. And I say thank you for including us in this pious venture. Clean air for everybody. Since many years, IRIA has been putting its effort with the aim that whatever air we breathe is breathable and clear. We started a program maybe 7-8 years before, in which every year we plant good quality trees across India through our 26 state branches and more than 200 city chapters. 3 years before, we had a feat being successful in planting 1 lakh tree in a single day across India, and even the government of India appreciated this task, and we were honored. This year again, on 22nd October, we hope to plant 25,000 trees in a single day across India on the Bapu Jayanti, at least 1 tree by each of the radiologists. As regard to reducing the carbon footprint and reduce the pollution, IRIA has formulated a committee through its academic wing ICRI, Indian College of Radiology and Imaging, and we are trying to reduce the number of necessary sequences in cross-sectional images as bare minimum possible, so that we can reduce the consumption of electricity and probably help make air cleaner. Some of these sequences, formulations are completed and they are available on our website. And by the end of this year, we hope that we will be in a position to complete this task. One more thing is what we wish the government must do is initiation of some kind of a medical equipment scrappage policy. I was very happy when I heard that the Transport Minister of the Government of India, he initiated certain automobile scrappage policy where incentives are given to the new automobile purchaser if they wishes to scrap the older automobile. In the same way, we have represented to the Honorable Health Minister of India about a month before. And next month, I am seeking an audience with the Law Minister of India, where we want to emphasize upon the fact that we should have at least one similar kind of scrappage policy for medical equipment in this country. Newer equipment consume less energy and probably give better diagnosis. So repetitions are avoided. And if incentives are given, I think this will help us make air more breathable and clearer. With this, I will not take much time. I again feel honored on behalf of all the radiologists of this country. I thank Dr. Arvind and all the other national president of esteemed organization from IMA, FIGO, FOXY, CSI, Pediatric Association, Neurology Association, Surgeons Association. Together, I am sure, I am convinced we can do something. We will do something. Thank you so very much, everybody. Have a nice day.
Thank you, Professor Pushpraj. As I said, you bring in absolutely new dimensions about reducing the carbon footprints of the healthcare facilities. And I think it's a huge area, and we would love to be continue to be in touch with you, along with our international partner, Healthcare Without Harm, which has done a lot of work in this area. We'll continue to be in touch with you. Thank you very much for your thoughts, sir.
You,
Now
Dr.
we move.
Yes, thank you.
Thank you. Thank you, Professor Pushpraj. Now we move to a very, very important organ that we are all scared of, the heart, the matter of heart. It's the most feared, but also the most loved organ in the body. And it's my privilege to introduce the Cardiological Society of India, which was founded in 1948 and has active members from many international cardiological societies, with an active membership of over 5,400. It aims to advance the scientific knowledge and research in the area of cardiovascular system and its all aspects to improve the understanding of cardiovascular diseases. And representing the Cardiological Society of India is a very eminent cardiologist of our country, Professor P.S. Banerjee, who brings with him over 35 years of experience as a practicing cardiologist and, more importantly, interventional cardiologist. And presently, he's the president of the Cardiological Society of India. And when I spoke to him, he actually sent me a beautiful slide set which depicts the effects of air pollution on the heart. For the sake of brevity of time, we are not sharing that slide presentation here. We would request Honorable Sir to share his thoughts about what CSI can do in this area. But I promise we will be putting up that slide set on the DFCA website, and we will also be sharing with all those who are attending this program. Over to you, Professor Parthsarthi Banerjee, President, Cardiological Society of India. Sir.
Thank you, Dr. Arvind Kumar. First of all, I extend my gratitude to you and all the members of the organizing committee for inviting me to talk on this occasion, which is a very, very august meeting holding the air pollution and impact on the system. And I believe this is a burning issue of our country, because we all know that India is one of the country having highest rate of air pollution. And that is why we are so much concerned about it nowadays. And Cardiological Society of India is not lacking behind about this matter. And that is why we are also trying to engage our 20 branches across the country to take the help of the different NGOs and the schools at the peripheral level to talk with the teachers, students, guardians to increase their awareness about the air pollution and impact on our organs, especially related to the cardiovascular system. We are also taking the help of artificial intelligence and digital platform where we cannot represent in person in the remote areas of our country through the branches. And there also we are trying to contact the local panchayat leaders and other concerned people so as to propagate the message of how to prevent this air pollution and its impact on the organs. And we have a long association with several international organizations like American College of Cardiology, European Society of Cardiology, International Heart Federation, World Heart Failure Association, and we will have the joint session with them regularly in our annual meeting. And now we shall definitely propose to include this agenda, how air pollution can be minimized and the reduction of its impact on the organs of the body, especially related to the cardiovascular system. We know that with the progress of the industrialization and urbanization, there is increase in the rate of air pollution and its impact, and resulting in huge number of deaths, especially from the myocardial infarction, heart failure, arrhythmias, especially to those people who are having pre-existing disease like this. And that is why the impact is so important and it requires prevention. We have planned to the sharing our thoughts in the CSI website so that all the members can visualize that how Cardiological Society of India is planning not only to prevent the cardiovascular disease from lifestyle modification, but also how we can prevent the impact through the clean air and how we can make it especially in the urban areas and rural areas where the pollution rate is very high. So this is really a very august platform where I got so many inputs from the different speakers and their contribution to prevent this air pollution impact on the health of our body. And I hope that if everybody works together, then we can go a long extent to prevent this air pollution in our country. We have association with Neurological Society of India, Indian Medical Association, and Association of Physicians of India. So we shall again talk to them, not only to increase the awareness about the cardiovascular disease, but also to take different webinars to see how the air pollution impact the different organs of the body in a joint platform. So that will also help to increase the awareness among the members of the two associations when they will collaborate this webinar meeting in a joint session. And international organization will also start talking, because nowadays we are mainly focusing on the impact of interventional cardiology and preventive cardiology. But this is also another important facet. We have to go ahead with this important agenda with the international association, so that in our annual meeting in the joint session, we can also keep some program where air pollution related cardiovascular disease and other organs can be discussed, and so that all the participants across the world and in the country may be aware of the impact of this preventive aspect through the joint session. I hope if we work together sincerely, that will give a long way and a huge success to reduce the air pollution of this country. And this is not an individual job. It is a combined job of the government and the societies, the NGOs, and the individual persons, by improving the housing, improving the air traffic, and improving the burning of the odds, which increase the air pollution, and introduction of more and more electrical vehicles in our country, as the union government is already thinking in that way, will help us to, in the future, to reduce the air pollution in our country. Thank you very much, Professor Arvind Kumar, for giving me an opportunity to talk on this August platform. Thank you once again. Thank you.
Thank you, Professor Parthasarathy Banerjee. You've opened up so many new paths for us. You've mentioned about putting these slide sets on your website. You've mentioned about sharing it with your members, which will have a huge role. You've mentioned about reaching out to IMA, API, and your other sister national organizations to discuss. And you've also mentioned about reaching out to your international sister organizations to raise this issue and have a discussion. I think if all these things actually get materialized, the aim of reaching this information to every doctor and through the doctors to every member of the society will definitely be fulfilled. Thank you very much, Professor Banerjee, for these lovely, wonderful, and very proactive thoughts. And we would be in touch with you. Thank you once again, Professor Banerjee.
Thank you very much.
Now we move to an organ which is actually the portal of entry for the pollutants in the body, the lungs, and Indian Chest Society, which is a not-for-profit society founded recently in 1980. So it's a baby organization compared to others who were established. And also in terms of numbers, it has 2,500 member chest specialists. But numbers do not represent the potential, because friends, these are the people who actually see the most impact of air pollution, because maximum impact is on lungs. And representing Indian Chest Society is its incoming president, a person who actually breathes the ill effects of air pollution in and out, the most cited person in this field across the globe. My pleasure to invite Professor Sandeep Salvi. Over to you, sir.
Thank you, Dr. Arvind Kumar. I think as the incoming president of the Indian Chest Society, my role is to ensure that the impact of air pollution on health is highlighted at all possible levels across all stakeholders. First and foremost, I think the patients need to be made aware that their problem, their ill health, is largely driven by the poor quality of air that they breathe. And what I liked, one of the presidents mentioned earlier about the prescriptions that we write must mention that, so that the patients are at least made aware that their asthma exacerbation, their lung infection is related to the poor quality of air that they were breathing. So I think once we create awareness amongst the people themselves, that itself will create some sort of a movement from the lay people's end to drive policy decision changes that we very badly need for our country. So that is one, creating awareness amongst the people at large. Second, as you very rightly said, the lung is an organ through which we start coming in contact with the polluted air. And many of us may not know this, but there's an entire size of a tennis court in the lungs that gets exposed to the levels of air pollution. So we have a very huge surface area through which the air pollutants are absorbed. But not only that, the air pollutants enter through the lung into the systemic circulation and start affecting the other organs. So clearly it is important to start sharing this information that is not only the lungs, other organs. So I'm so happy that this Doctors for Clean Air includes the gynecologists, the pediatricians, the cardiologists, the neurologists, and everybody who should be a part of this important stake about the impacts of air pollution. So I think it's our prime responsibility as the owners of the space of so-called input of air pollution to educate the other specialties about how their organs are also, the organ systems are also getting affected. So I think these are key important activities that I think are necessary for from the Indian Chest Society perspective. And such a pleasure to see a surgeon actually drive this entire initiative. And it only happened because Dr. Arvind Kumar could see the color of the lungs when he was operating, that he got shocked and struck by the impact of air pollution and health. So until you see such organs, you don't realize the impact of that. And I think that's such an important initiative taken by a surgeon that is impacting a whole host of different specialties in this field. So all the very best to Doctors for Clean Air, and all full support from our end as a member of the Indian Chest Society. We would like to be a part of this very important initiative. Thank you.
Thank you, Professor Salvi, for that very brief but very pertinent and impactful message. You also have been guiding us and have been associated, or rather our lead as far as our research activities are concerned. And I'm sure we have a long way to go still, because this problem will continue to be there for quite some time and needs Herculean efforts on the part of each one of us. Thank you, Professor Salvi, once again. And now I move to the matters of brain. And Indian Academy of Neurology, friends, is a professional body of neurologists from across the country, formed in 1992. So it's actually the baby organization compared to all other organizations, has 1,500 neurologists as its members from across the country, meetings, symposia, workshops to liaison and advocacy for national and international agencies in the field of neurosciences. And representing Indian Academy of Neurology here is a very eminent neurologist of our country, Professor Manmohan Mehendi Ratta. He is the former professor and head of neurology from GB Pant Hospital, New Delhi. He is the Emeritus Professor, National Academy of Medical Sciences, currently Senior Director, Department of Neurology, B.L. Kapoor Hospital, Center for Neurosciences. More than these academic qualifications is the fact that he is a person who's been committed to the cause of clean air, and he was very instrumental in our previous version 2 years back when we had a full 1-hour program with Indian Academy of Neurology. Professor Manmohan Mehendi Ratta, a warm welcome to you, and over to you, sir, for your thoughts.
Thank you so much, Dr. Arvind. At the outset, I'd like to express my gratitude for asking me to come. I have learned a lot today from my fellow colleagues, from my fellow societies. I would like to highlight some aspects.
Sorry, sir.
Yes,
sir.
sir.
I'll interrupt. I forgot. Professor Mehendi Ratta is the former honorary secretary and also the former president of the Indian Academy of Neurology. My apologies, sir.
No, thank you so much. Hope I am audible and slides are visible.
Are, sir. You are.
So we all have one aim, that is to for blue skies. And Dr. Arvind Kumar has taken the initiative and we will follow his steps. I'd like to highlight what do I do for the clean environment at my residence. In my apartment, I have a greenhouse and I have greenhouse in my office, which is very, very uncommon. Now, in addition to that, what I have done at personal level or at the academy level, I'll be showing here some of the aspects which have been done on this aspect. You see these photographs. I'm very fond of this photograph to show whenever I'm giving a talk.
Sir, your
on
slides are not moving. We have
not
the
moving.
slide. We have the
But
first
slide not moving. How come? I think I'll share again. I'll stop
now
sharing and then share.
we can see it now, sir.
I'll stop and share again. Is it visible now?
Yeah.
Is it visible now?
Yes, sir. Yes, sir. It is.
Yeah. So this is what air pollution is. The various sources can be in-house, outside the house, in the field, stubble burning, engines, vehicles. So I will not go into generic talk because as Dr. Arvind Kumar remembered that I have given talk 2 years back. So that was so nice of him. The other is this in 2016, most stroke worldwide caused by modifiable lifestyle risk factor, air pollution is to blame 1/3 of cases. I hope this is visible, Dr. Arvind Kumar.
Yes, sir.
Okay, sir. Now I come to this. So neurology of air pollution, what has been done at personal level? I gave a talk in 2015, which is a very important organization, an Indian Academy of Neurology annual conference on neurology of air pollution. We carried it forward and then suggested this was one of the sessions. And this was the one which Dr. Arvind Kumar was saying I have saved in my database also. Dr. Arvind, this was from Kritika in 2020, that this is a reminder that Doctors for Clean Air Conclave will begin in 1 hour on. And at that time also I spoke, but I spoke on generic. This time I'm not going to spoke on generic particulate matter, size, how it mates, lungs, anti-inflammatory response on the brain, headache, cognitive decline, irritability, Parkinson, Alzheimer. Those I'm not going to talk because time will not permit. So this neurology of pollution, I have given few talks. I am very fond of this photograph. What appeared in Neurology India. So what Valerie Fegan said, a close friend from New Zealand, and he is in IHME in Washington, also associated, and I am also in collaboration. Air pollution can't be viewed as another country problem, they wrote. With the ceaseless air stream across oceans and continents, what happens in Beijing happens in Berlin. He talked only about Beijing and Berlin, but what I said, also Kashmir to Kanyakumari and Kutch to Kolkata. So we have to keep in mind that same happens in our country rather in a much intenser way. So this is another talk which I gave on stroke, how we are making doctors aware. That's the main aim of this conclave. So this was a systematic approach to stroke in young, a predator to the young brain and what is new. And I talked about air pollution. Now, I'm thankful to Dr. Goel, last few slides and I think another 1 minute maximum. I said to Dr. Goel that we want to bring out, he said, sir, good idea, a supplement on neurology of air pollution. Because I have given some talks and Dr. Arvind liked, Dr. Vinay liked, and Dr. Vinay Goel gave me go ahead. He's there in the audience. I took his permission in the morning to show some of the articles. He has already shared some e-print ahead of the physical print in the chat group. So this is soon going to come. And Save the Mind, Air Pollution and Brain Health. This is what I am the lead in the editorial. Along with me are 2 young neurologists. This will make aware not only in India, but also all over the world, those who cite this article or access this article. So we have gone beyond what I have been talking earlier. Then air pollution and cerebrovascular disorders with special reference to Asia and overview. My friend in Aga Khan University, Mohammad Wase, professor, I asked him, why don't you write? I am also one of the participants, but they, in a multi-authored, they wrote this. And similarly, evaluation of effect of air pollution on cognitive function, cognitive decline and dementia from Turkey. What you say now, Turkey, earlier we used to say Turkey. So from that, so it is a global actually issue, and it's not only Indian issue. Then comes an article, environmental toxin and brain life on earth is in danger. Very beautifully written. I think if you get, there are so many things to read, but if you get time, please spare some time to read this article. Air pollution and intracellular hemorrhage from Singapore. So Pakistan, Turkey, Singapore, 2 articles from Singapore, and then comes from India. Another is air pollution headache disorder. Actually, irritability and headache is much more common. Many other air pollution conditions. This is very important. From Japan, current evidence for the association between air pollution and Parkinson's disease. Somehow I could request all of them. There's a environmental group in the World Federation as well. So Hidehiro Mizusawa is a very close friend from Japan, and he kindly consented to write this article. So with this, I like to stop. We'll continue our endeavor to have collaboration at global level with our societies, what I say, intra-synergy and inter-synergy collaboration with our other societies as well as all over the globe. Thank you so much, sir, for kind listening and patience here. Thank you so much.
Professor Manmohan, thank you so much for sharing with us that in your international federation, you have an environmental group which is led by your colleague from Japan. And along with him, you've been carrying out, or rather publishing, so many studies from across Asia and other countries. I think it's one of the most important activities to publish them, to reach out the information to people. As I said in the beginning, although so much is talked about, but having traveled across the country, I would like to share that even today, the knowledge about air pollution, even amongst doctors, is not what it should be. How grotesque these effects are, they're not aware. And I think writing these articles and sharing information, sharing slides is one of the very important activities. Thank you, Professor Manmohan. We'll continue to be in touch with you. Thank you, sir. Ladies and gentlemen,
thank you so much.
Welcome, sir. It was indeed an honor to have you here, sir. We come to the end of this presidential session, and I would like to thank the presidents of Indian Medical Association, FIGO, Professor Jean Connery is still here, IMA, Professor Sajanand, then all other associations whose presidents have taken time out of a very busy schedule on Sunday morning and given thoughts. We've noted down each of the suggestions given by each one of you, and only one humble request I'll make to all of you, that let this not be a one-time association. Doctors for Clean Air would love to continue to be in touch with all of you and work relentlessly, tirelessly to reach this information to people and to keep working till the goal of clean air is achieved. Once again, my humble thanks to all of you for your time. And I hand over the platform to Abhishek for continuing with the next guest lecture. Over to you, Abhishek.
Thank you so much, Dr. Arvind. Thank you so much. For the next guest lecture, I would like to invite Dr. Rameshwaran Sorokhaiban. Dr. Rameshwaran is the Deputy Director working at National Program on Climate Change and Health at National Center for Disease Control, Delhi, under the Ministry of Health and Family Welfare. With an MD in Community Health Administration from National Institute of Health and Family Welfare, New Delhi, and a DNB in Health Administration, including Hospital Administration, he takes part in the implementation of the program-related activities for the National Program on Climate Change and Health. He is the present nodal officer on air pollution-related illness under the program. We are delighted to be partners with the National Center for Disease Control for this program and many other initiatives on creating awareness about health impacts of air pollution for faster action towards cleaner air. Dr. Rameshwar.
Thank you very much. We are blessed to participate in this great platform where these medical associations can be a great multiplier in the efforts, ongoing efforts to address the health issues due to air pollution in the country. I would like to give a presentations on this regard, and I'm presenting from the program side, representing the states and representing the these district nodal officers or officers and all program officers and all who are participating in this platform. Okay, is the slide visible? Okay.
Yes, Dr. Rameshwar.
Okay. Under the National Program on Climate Change and Human Health, addressing health concerns of air pollution is a priority, is one of the priority subjects. And in addressing this air pollution, it consists of mitigations and adaptations. Our health sector is primarily working on the adaptation issues. And in this, the ministry, at the same time, the state health department, healthcare facilities, the medical fraternity that we have today, and the allied these healthcare services, including the clinicians on the who are supporting the associations, who are part of the association, would require for the leadership role and partnerships, and they can be great game changers of the in addressing the issues in the country. Our health issues due to these climate change and air pollutions, these are addressed through this program with the 5 key objectives, and this includes about advocacies and awareness generations, and this would be at all levels in the policy makers, and it also consists of the vulnerable populations. It also consists of the all the relevant stakeholders, and the second part consists of capacity building, where the training and this guideline developments of the health sectors for the capacity building of these subject issues, where all these our clinicians and the medical association can be taking part in supporting the supporting all these achieving the objectives. The third one is about the strengthening of the healthcare, this healthcare sector, this preparedness and response mechanisms, which has one of the important priority of surveillance establishment on air pollution in the country, and this is prioritizing to the non-attainment cities and across other cities from which we feel that there can be these reports of local level evidence on the air pollution related illnesses. The fourth part is quite important, and it is the matter of this platform today also. It's about the collaborations and partnerships from all the relevant stakeholders. And the last one is about the research, and the research requires more of the focusing on the policy implications, so that the interventions measures like uses of these face masks also, and air purifiers in the Indian settings, whether it is really helpful for the peoples. This can be communicated to the people. There are 3 centers of excellence which is under the program, which are supporting the program in addressing these these air pollution related illnesses. There are other program areas which are also focusing at the present moment. This is about a little about the program that I'm saying, including air pollution. And this consists of vector-borne water association, heat-related illnesses, and green and climate-resilient infrastructure, where many of the association has spoken about the green components of all the low carbon emission areas. This is a framework, structural framework. The program has a proper structural framework in the country, beginning at the Ministry of Health. Then we have the NCTC as the technical nodal agencies in implementations of this program. At the state level, we have the these environmental health cells, where the state nodal officers are well placed, and we have at the district level also the district nodal officers who are working on implementing this on the issues of all these climate sensitive issues, including air pollutions. And we have a well-developed district health action plans, on regarding about the program also including these air pollutions. Regarding about these 5 objectives that I discussed, one of the main is the awareness, the generations or the advocacies of this program, including this air pollution, in which the national program has already developed IEC materials in many ways, in the form of posters, in the form of social media messages, GIFs. There are about for audio, there's also translated in 7 regional Indian languages. There are 71 videos also, which can be used for the this IEC purposes. And all these IEC materials are also shared with the states, our states stakeholders, program officials, and they are using this one for imparting all these awareness generation in the states. They also translated into the local languages for their customizing for use in their own areas. The other part is that about the public health awareness, these events or campaigns, as we do today, we have been doing in the last 3 years. And this is a week-long activity that we are doing. And in this year also, we will be starting from 7th to 10th of for about 4 days in the states. And the state will be focusing on awareness campaign for women and children and traffic policemen and municipality workers. These are the main focus in the states, which will be working through all the mechanisms that we have under the government of India, under the state government health department. The 4th one is about the public health advisories, which we have been developing and which we have been updating, this regularly. These are the regional language that we have, this developed in the form of this Punjabi, Gujarati, Marathi, Telugu, Bengali, Kannada, and this Oriya. So, these are the dominant, some of the main regional languages that we have, considered at the present time, and this will be expanded to all the others, this regional language also. As you can see, these are some of the posters that we have been developing, that we have been circulating with the states also. And this is not only that, this is also at the central level and at every level that we are using for disseminations. This is in Hindi and English also, and the states are also, this translating all these IEC posters in their own regional languages. This, as you can see here, these are all the regional languages IEC posters that they have been using in the last 3 years. This is the recent update of the advisories for the air pollution. This is mainly focusing on the health aspects, and we focus this time more on the healthcare service provisions at the healthcare facilities also. And here, our clinicians or medical associations can take the lead and can do the partnership with the all the with our government these officials and this can be implemented in the clinics that you are presenting in different places across the country. We also have developed one of the part which will addresses the during the high levels of air pollutions, like the Diwali time, like the stubble burning days, during the winter, these months when smoke phenomenon occurs, and smoke phenomenon is a classic syndrome and a classic phenomenon that have been widely known, and in that these deaths and health issues have been observed. These are some of the videos that we have developed under the program. And as you can see here, these are the national guidelines that we have developed on these air pollutions and health issues, the health adaptation plan for this due to air pollutions. And based on this, the states have also already developed their own state action plan on climate change and human health. In that, one chapter has on air pollutions. This is also a part of that. And then right now, 8 states have already developed all these state action plans, including these air pollutions, and others are still developing on this. And this will be completed. The drafting is still continuing. It will be completed in the next few months. And there are certain other handbooks, infographic handbooks, which we feel that with the help of these infographics, this will clearly give some simpler message to the health professionals. The other part is that we do this training to the states, to the district official program officials, not only that, to all the medical officers, to all the surveillance nodal officers to all the community level health workers across the country. This has been doing the last 3 years, and we have been doing continuously, all these things. And we have also been doing these online webinars with all our key these stakeholders who are supporting the program, from the Ministry of Environment, from the Central Pollution Control Board, from the WHO India, from the AIMS, from IIT Delhi, who are really supporting the program at the moment, in the last 2 and 3 years. And this has been conveyed to the state program officials in the country. We have also conducted all the district nodal officers in this training program and all. And during the national review meeting, we exchanges our experiences, and we update ourselves, and we share what we have in the states. These are the training modules that we have developed, and this emphasizes on the women's and the children. We realize that the women and children are disproportionately affected by the air pollution. So the program also focuses on that, and through the community level health workers, we reach to the outreach part of the country where we can say that is the unreached areas. These are about the traffic and the policemen, and these are about the these municipality workers. We have been sharing these to the traffic police department. We also this sharing these to the this municipal MCDs and all. These are some of the snapshots that the states are reporting us in the forms of the this capacity building, in the forms of the activities that they are doing across the country in the last 2-3 years. The surveillance is one of the concerns about the program, and the surveillance, through surveillance, we understand that we can understand the train of the air pollution related issues or the disease in that city due to the acute, and we try to correlate with that, and we try to take actions, give feedbacks on that, and give the these information to the relevant city. There are about these 18 states who are involving in this surveillance, sentinel surveillance on air pollution related illness. Presently, we are working on this acute respiratory illness in relations to this air pollution. We are trying to expand into the cardiovascular diseases also. We are trying to expand into the cerebrovascular diseases also. We'll be expanding to the others who are impacted because of the air pollutions. This is the recently updated SOPs on sentinel surveillance of these air pollution related illnesses. And this is particularly meant for those who are working on that, engaging in the surveillance purpose, and that is from the sentinel hospitals at the city level, and the district nodal officers, district program officers who are coordinating and analyzing all these data, and at the central level. We are also working with others ministries. We are working with also other these organizations and all for the support for the successful achievements, implementations of the program objectives in the country. With CPCB, with the Ministry of Environment and Forest, the CP division, which is working on the NMC, the National Mission for Clean Air. This is the slide that I would like to focus for all the medical association. This has been, having the galaxies of these clinical experts, and in that, if some actions could be taken up from the medical associations and the clinicians across the country in terms of advocacies and awareness generations, while you're doing in your clinics, while you're doing in a panel discussion, while you're doing and giving your health talks. And while it is, making as an agenda in your medical associations, this conference, these are some of the suggestions, and this could really benefit the peoples in bringing a social and behavioral sense on the thinking of this air pollution and its health issues, and the ways of this, preventing and just protecting themselves. The second part is that being the experts in this area, in the medical fraternity can, support in the training of all the medical officers, all of these health professionals, community level these workers and all in the states, in the districts and all. And this can really strengthen the the efforts by the program in this implementing the programs across the country. And medical teachings, because we are trying to put this medical in the medical curriculums of air pollution related concerns, health concerns. Not only that, high climate change and health concerns. These are all the accepted by the six this medical and allied organizations. There's the NMC, NMNO, National Medical, and the nursing, this Council of India. All this, this will help in the inclusions of the aspects of air pollution and health concerns in the for the medical students and the objective of the medical students in addressing the health concerns that we are finding right now, so that in the days to come they can they will be readily skilled to handle all these cases. The last one is about the support, because the city is at the present moment having the ongoing this sentinel surveillance. So we request all the medical associations and the clinicians to support, to let the medical world, the medical fraternity understand that this is really, this is required for the generations of the health issues attributed to air pollution at the city level, because we don't have much evidence on the ground. So this will be very, very important. This will be very crucial to bring up. And I really, request the clinicians to support on these areas. So ultimately, it is the leadership and the partnerships with the ongoing activities that the National Program on Climate Change and Human Health, which is advocating through the 5 objectives. And if we can, come together and we can become partners, and if the clinicians take the leadership in that, then I think the issues would be readily resolved, and that would be not that difficult. Thank you very much to all of you, for providing such a platform, and to all the in the galaxies of all these experts from different areas. Thank you very much to all of you.
Thank you so much, Dr. Rameshwar. It's phenomenal work that NCDC is doing with creating so many awareness material and reaching out to so many different stakeholders in the society. And we are looking forward to working with you on creating awareness on health impacts of air pollution for faster action towards clean air. Moving on to the next session, we have a very exciting panel discussion with members from international and national societies. To lead this panel discussion, I would like to invite Mr. Rajiv Khurana, who is the founder trustee of Lung Care Foundation. He has over 42 years of industry, consulting, and training experience with a variety of multinational corporations, Indian corporates, international UN bodies, funding organizations, not-for-profit organizations, colleges, and schools in India. He has worked extensively in India, Asia, and Africa. He's an international management consultant, trainer, venture mentor, executive coach, corporate board advisor, author, writer, photographer, blogger, and social entrepreneur. Mr. Rajiv Khurana, it is my honor to invite you for our panel discussion on rechristening the role of healthcare professionals for clean air.
Thank you so much, Abhishek. This has been a wonderful, phenomenal session so far. We have heard the leaders who have given us the light, way ahead, and the challenges ahead also for us. In the beginning, we were talking about, if not us, then who? Let's also extend that, if not now, then when, who, and how. And this shall be the perspective with which we shall be deliberating today when we talk about rechristening the role of health professionals towards cleaner air. Listening to the leaders was fabulous, and therefore it outstretched the time also. So now we have a dilemma in which we will have to quickly take a call that the next sessions reduce the time by 20 to 25%, and also, if needed, we extend that time from 1:30 to 1:45 so that we could actually listen to the wisdom of so many people who are now waiting to share their expertise. This session is going to be lively, shorter, quicker, and I would expect my audience to also ask me some questions in the Q&A box, but please don't make statements. Your question a one-liner, because otherwise you are going to make it very difficult for me to do good justice to your questions. And then please also mention who are you asking that question to. And let me also take the privilege of quickly introducing my panelist. I'm glad to welcome Dr. Akash Srivastav once again into the panel. And he's, as Dr. Arvind has already introduced him, he's the Additional Director and Head, Center for Environment, Health and Occupational Health, Climate Change and Health at National Center of Disease Control, Delhi. Welcome, Dr. Akash Srivastav. Let me also take the honor of inviting Mugdha Jain. Mugdha Jain is the Indian country head of Clean Air Fund, a philanthropic initiative tackling global air pollution. She has over 15 years of experience and has worked in advisory and leadership positions in the development sector so far. I'm delighted to invite Manjeet Singh Saluja, who is a National Professional Officer, WHO, and he brings in a unique blend of working on interdisciplinary issues of health, environment, and climate change. And Mr. Sanjay Vashisht, we welcome you in the session. He is the Director of Climate Action Network South Asia, shortly called CANSA. And under his leadership, CANSA has increased its membership base from 20 to 300 NGOs within the region. That's phenomenal. And of course, our young leader, Dr. Prabhat Jha. He's an intern at Dr. Vasantrao Pawar Medical College, Nashik. He's the president of MSAI, Medical Students Association of India, and also chairs MSAI Biotech Unit. The format is very simple. We'll try to keep this discussion to around 25 minutes, and in which I'll ask some specific questions, some generic questions. And to my panelists, if someone has already answered and you feel that, okay, you can also add 10-second bite, just give me a signal. So I'll invite you to also share your opinion, but we'll have to move faster. Mind it, this is a T20 game going on. And the asking rate right now is 22 runs and over. And we are going to be winning this match, definitely. And of course, people will enjoy today evening's match with Pakistan also, which we are definitely going to be winning. So let's win both the tournaments. So my first question, which is an opener, is in terms of a changing perspective. We generally say, how was the profession 10 years ago? How's the profession today? And how do you think the challenges and role of health professionals could be in times to come in the next 10 years vis-a-vis air pollution? So Dr. Akash, let me have your 15 seconds bite straight away. Unmute yourself, please.
Thank you. So I would say 10 years ago, hardly anyone recognized this risk factor and how it influences the health of the people. Today, I will say people are talking about it, but in my understanding, I would say it is still in whispers. We need to do much more. And 10 years later, I hope that the doctors would be viewing days when the air would be clean and the skies would be blue, hopefully. But if not, then we should have made substantial progress by then.
So you're raising a point of concern, definitely, Akash. Mugdha, what is your perspective on this, please?
Thank you, Rajiv. Very simply, I see the transition of the role of health professionals in the context of air pollution from restoring health a few years back through diagnosis and treatment to maintaining health through disease management and moving on to actively promoting health. And, as the WHO says it very nicely, and Manjeet will correct me if I'm wrong, is defending the population against what threatens their health and making it possible for individuals and communities to participate in decisions affecting their health.
That's wonderful. Manjeet, what's your perspective on this?
So I think since the asking rate is pretty high, so let me quickly share that, the changing, the health professionals' role has kind of changed as per the evolving landscape of the country on air pollution. So it really met the public eye in the mid-2010s, I would say. 2015, 2016 was the time when people started taking a serious note. Although it was not that air pollution did not exist. Even in the 90s, the Indian cities had started kind of turning into that toxic kind of area. And we already had a strong legislation in terms of the Air Prevention Control Pollution Act of 1981 and all. And in 1996 was the first time when Delhi government submitted to the court its first action plan to combat air pollution. So there was already things happening at the policy front as well. But there was a dichotomy, I would say, in the mid 2010s, even though there were a lot of concrete actions being taken, but there was also a denial at that time. So I would say the role of the health sector was at that time to kind of share with the policy makers on the negative kind of health effects of air pollution on the Indian population, as well as kind of there's certainly more research which is needed, but there is ample at that time itself to take action. So there was kind of there was denial, but as I said, there were actions being kind of taken in terms of the launch of the NAQI, the National Air Quality Index, sharing of the standards and a revision of the standards in 2009. So I would say kind of at this stage, the health economic, even the economic benefits and the other benefits by now are well documented, and they are kind of offers strong arguments for transformative change. We may not have the data up to the last decimal, but it is sufficient to indicate that urgent and strong actions are needed. So I don't even need to have a kind of a time stone or Dr. Strange from Avengers to say what kind of it is now not only the time for the health sector not only to support, but certainly take a lead and kind of because health is non-negotiable. I'll stop over there.
Wonderful, Manjeet. So the best time to make a change was 30 years ago, and the right time to change is right away now. Sanjay, what is your perspective from cancer?
I'll speak more from the climate change perspective because I have least knowledge about health, but more from the vulnerability. Climate change and air pollution are two. One is a phenomena. Both are phenomena which leads to disasters, slow onset as well as extreme disasters, and that's because of excessive dependence on fossil fuel. So keeping that in mind, 10 years back, I saw health professionals, playing a role of curing or basically treating the patients who are coming from because of impact of health air pollution. I think it's time. We have seen in last few years that it's the health professionals whose words are taken very seriously by people, and that role they can play in terms of spreading awareness, building mass awareness about it, and ensuring that people expect from their leaders to also work on air pollution.
Wonderful. Prabhat, how do you look at it as a young doctor and the challenges you foresee in times to come?
Thank you so much for the question. I would say that at this point, as a young doctor, if I would have to envision something with respect to clean air in the upcoming 10 years, I would say that the student engagement, the youth engagement in the whole cause is multiplied from what we have it right now. The students are identified as key stakeholders in managing such issues. They are the ones who are heading this whole initiative from the front. And these students, like the students right now, would be physicians or clinicians in the 10 years. So this is the point wherein the students or the curriculum which we generally tend to discuss about, this is where we intervene so that 10 years from now, they know what exactly needs to be done to curb such an important issue.
Wonderful.
Thank you.
In fact, one Shair had said long back, दोनों तरफ है आग बराबर बुझी हुई, कुछ वो बेखबर हैं, कुछ हमको नहीं खबर. Perhaps that's the way we started our journey. But today, when we are talking about and discussing about these things, we are looking at 3 dimensions as of today. That when we look at doctors as well as the society, we need to focus on the wake-up call, the shake-up call, and the make-up call. Wake-up call because we need to create a lot of awareness amongst the people, and shake-up for those who are not listening or those who are pretending to sleep. But at the same time, Manjeet, people are asking me questions in terms of the role of WHO in capacity building. So talking about all this doesn't make sense unless and until we help people in terms of the enablement process itself. So that brings us to a very important question in terms of creating synergy amongst multiple stakeholders, whether it be the government, the medical associations, the organizations, the international organizations, the United Nations, etc. How do we actually pool in our thoughts, ideas and actions so that we can create results. Maybe, Mugdha, you take the lead and talk about this, and then I'll come to Dr. Akash later in terms of putting up the government perspective.
Absolutely, Rajiv. I think it's an excellent question to reflect on. As a philanthropic initiative, we would like to, we would like to provide support or catalyze resources. But where I see, the impact being channelized most effectively is through strategic collaborations across, all the different aspects that you've mentioned, right from research, supporting credible research, generating and creating a stronger base of evidence, which is acknowledged and acceptable in the policy circles, of course, which is contextualized and localized to Indian conditions, because there are a lot of gaps. There, as Dr. Arvind already pointed out in one of the earlier panels, a lot has been done, but there are a lot of gaps. We do not know the life course impact of air pollution on, through early exposures, for example. We don't know the impact of people living with chronic conditions on their health, on their opportunities lost, on the quality of their life, etc. So there's this whole collaboration with researchers and think tanks. And then you have your civil society organizations, those who can help engage with communities who are disproportionately impacted by air pollution, but their voices are not heard or amplified. So they help you engage with them, bring those voices into the discourse, and also, humanize the issue, make the scientific and medical terminology more humanized. Then you have your strategic communication groups who can help build a very effective narrative, linkage between air pollution and the impact on health, and deliver those communications. They are best placed to identify what channels to use and, how to build the narrative, etc. Of course, academia and international organizations for capacity building, as well as for early integration with medical training. And of course, the donor community is always there to catalyze resources, in my opinion, I think. And then, of course, building all of this together, this ecosystem is eventually to create urgency in policy action. So you have your government stakeholders. Back to you.
Thank you so much, Mugdha. That's a very extensive answer. So let me add another question for Manjeet and Sanjay, that when you are talking about creating synergy, maybe you can also bring in some aspect of international examples so that we could imbibe that in India. Manjeet.
Okay, so international experiences, maybe as you said about WHO's role about capacity development, and I also saw one of the questions. So it can be at two levels. One is at the system level I would talk about, and also at the individual action. Although there are ample examples within our own country, but let me share what the other countries are also kind of not doing, especially from the ones from where we don't hear much about. So at the system level, the countries are kind of responding based on the issues at hand. For example, let me give you an example of Kenya, where more than 80% of the population still depends upon those polluting fuels as the primary source of cooking, something that worsens the household air pollution challenge to kind of health, which is among the top 10 risk factors for death. So what Kenya is doing is, Kenya is taking steps to strengthen its primary healthcare response. They have developed ample resources like facilitators, guides, other resource material that is being used in the capacity building and training of community health volunteers, among other public health professionals in that preventive and promotive health space, but including, but not only limited to public health and health promotion, but also moving beyond to the community. And these steps enhance the efforts of the government to increase access to their essential primary health services, which they have already outlined in one of their strategic frameworks. So that's on the system level, but also every time the action does not have to come only from the system. Let me share maybe a 10-second story out here of a community health worker from Cameroon. His name is Mr. Elvis Nicodome. And so Elvis has led advocacy action efforts towards requesting and successfully establishing a collaboration with Ministry of Health to facilitate air pollution and health training of the staff at the healthcare facilities and general public to raise awareness for air health in Yaoundé. That's the capital of Cameroon. What he did was he engaged with the students in the faculty of medicine, doctors in the Jamaat hospital through the one-to-one counseling on need to advise patients on air health. heads of the teachers of school, encouraging them to support including air health in the school program, as well as obtaining partnerships to train students and pupils. So that's kind of an action which he catalyzed as kind of a community health worker. Another very quick example I can share is of Dr. Henrique Barros, who is a medical doctor from Brazil, as to how he used air pollution and the citizen science in the health community in Brazil. So Henrique kind of collaborated with the engineers to build these low-cost air pollution sensors which measures the PM 2.5. So the monitors were financially kind of crowdsourced. They were placed at the local health centers, and PM 2.5 data which was generated was used to train the health center staff, educate patients in the community using that citizen science approach, and to advocate for action to reduce community sources of kind of air pollution. One of the hospitals, as I kind of heard over here, that how air quality data has been displayed directly to the clinicians and in the patient records as well, to include education and kind of suggested action. The Great Ormond Saint Hospital for Children in UK has collaborated with the Imperial College of London to display that annual PM 2.5 and NO2 levels to clinicians based on a patient's postcode. So these both kind of individualizes the risk and also allows the educational support for staff and patients to be delivered and shared during their routine clinical activities. So that's what both clinic and clinicians and patients kind of will need this support to help with what can I do about air pollution despair, that this knowledge kind of could help and create. So these
Thank
are some
you
of the
so much,
examples. So,
Manjeet.
yeah.
This was a wonderful rapid fire example sharing that you have done. And let me assure you, even other countries will talk about what India is doing, because Lung Care Foundation also created multiple success stories working with the doctors, with the youth and communities right inside the underprivileged communities. And maybe someday we can make a presentation also about that. But now the question is, when you are working with the multiple NGOs, Sanjay, you would also know the pain and the dilemma vis-a-vis the health, the climate action, etc. So where do you see the need and speed of creating that synergy?
Rajivji, the biggest gap that we have seen, if you look at the vulnerability or need to build resilience, I'll quote some examples here. When we started looking at adaptation and long-term resilience, we found that technical knowledge on agriculture sector, water sector exists in the civil society, not on the whole health sector. We didn't have medical practitioners who will bring in the technicalities that we will be able to integrate in our response. And that was the most missing part. And that is why when we look at any kind of resilience strategy today, agriculture, water, or even forest, more from the perspective of strengthening the livelihood, are the prominent one. Health chapters are not there. In fact, now national adaptation plans are including health also as one of the chapters. We have a health mission also who looks at climate change. So, and that's what has changed in last few years also. That, and thanks to Lung Care Foundation, Health Care Without Harm, our initiative where we have been able to bring South Asian medical practitioners together, which is an excellent example where more and more informed and aware participants go out and speak about need to integrate climate change as one of the threat, or air pollution making you more vulnerable to climate change impacts. Because weaker lungs would mean you are more vulnerable compared to next person standing to you who has a healthy lungs. So certainly that's the biggest gap that existed, which we are trying to bridge. It's a long way to go, but I think we need to keep working on it.
Wonderful. So long as we are on the right track, that matters a lot. But Prabhat, you and your friends from the medical community who are going to be the future leaders in the medical profession must be wondering, यार ये लोग मिलकर काम क्यों नहीं करते इकट्ठे? So what do you think is the perspective the youngsters look at it in terms of the challenge? Because maybe you would be thinking, हम होते तो हम पता नहीं क्या-क्या कर लेते. So let's understand the perspective of the young health professionals vis-a-vis whatever we are talking about in terms of creating synergies. Prabhat.
So, yes, that is, that actually, I would say, I think at some point of time, everyone here has been a 20-year-old. Everyone has had those thoughts that what is just happening. But yes, as we move ahead, as we look at the system, we do also realize that there are certain protocols, there are certain processes that the stakeholders or the adults are following. So yes, we do realize that efforts are directed towards the greater cause. We do realize that there is much more work that sorry, there's much more work that is going on. But yes, at the same time, as I said earlier, one of the biggest challenges that we face with, like not just in one of the advocacy platforms like here for Clean Air, but as a matter of fact in multiple platforms, is when students or the youth are not completely or equitably recognized as one of the key stakeholders. So yes, it is important that even in this particular process, because when we are asking for clean air, when we are looking forward to reduce AQIs, when we are looking forward to a more sustainable environment, it would be a process. It would be a process which would take years for us if we start acting now. So if we start acting now, that means the students right now, as I said again, would be the clinicians in 10 years. Until then, these are the ones who would have to take the whole initiative forward. So it is important that at this stage itself, the students are involved in the whole process. The students get their own voice. The students get their own seat at the decision-making tables of all these protocols, so that in the due course of time, when these students take the leadership position as the dignified stakeholders here, they would know what needs to be done more, what needs to be done better.
Wonderful, Dr. Prabhat, wonderful. In fact, as students, you should be demanding in terms of more learning coming your way vis-a-vis the impact of air pollution on health. And even if the course curriculum is not being redefined, please ensure, ask us. People like Dr. Arvind Kumar and other senior doctors will actually conduct special sessions, even online, to educate all the young medical students in terms of all the challenges you are going to be facing in times to come. Wonderful. Thank you so much. But Dr. Akash Srivastav, you are leading the government here, and you have heard different perspectives. Generally, when we ask a common person, he says the government should do something. Well, at Lung Care Foundation, we do not think like that, because we believe everyone has a role to play. The government plays a role. Other people also have a role to play. So how do you look at the perspective? Not only in terms of saying what the government should be doing, but also putting a demand to all these associations and international bodies and maybe organizations like Lung Care Foundation that come forward and do join in the public-private partnership so that we can create collectively some impact. Your version. We are running against time, so we should be concluding shortly.
Okay. So what I would say is that the pollution is a huge monster. No one organization can tackle it on its own. So definitely everyone has a role to play. In context of how government responds to it, there is a entire Ministry of Environment and Climate Change, which deals with air pollution in the aspects of mitigation. It has recently launched the National Clean Air Program, which addresses down up to the city level plans for the cities which are affected by air plan, multi-sectoral plan, engaging all the sectors of government that may have a role in mitigation of air pollution. It works with other ministries, be it Ministry of Power, Ministry of Transport, or others to help in technologies that can help in mitigation. And it is open also to all academia and to non-governmental organizations to come together in the National Clean Air Program and provide their input on how it can help. On the other hand, when it comes to adaptation matters, we also recently have now a new program will launch, headed by the Ministry of Health and Family Welfare, the National Program on Climate Change and Human Health, which addresses the issues of air pollution and health. And as Dr. Rameshwar in the morning, he came around to explain how right from the issues of awareness to capacity building, to making health sector resilient, to research and areas of collaborative partnerships are being addressed under the program. Again, once here, I would say all the associations, academia bodies and other organizations of medical and other health alliances, other health professionals are welcome to associate with us. We have a presence in the state government, we have a presence in the district government. Wherever you are, you can come forward and help in area of creating awareness. we have more address to the governmental organizations which work like government, healthcare centers and hospitals and doctors. But when it comes to understand that the healthcare sector in India is hugely dominated by private sector. So all organizations need to come together if we have to bring a total effect into this area. And then it is an individual level, not only as a citizen in putting down the pollution, also as an individual level contributing to raise an understanding of air pollution. The role of a doctor is not only in bringing down the mitigation, but to create an evidence. As in the morning we had speakers talking, documenting air pollution in the medical case notes, in prescription, counseling to the patient, writing do's and don'ts, making an account of air pollution in those medical sheets so that they translate into data and go into the surveillance system. Please, all hospitals, private as well, participate in this surveillance system that we have put up under the National Program on Climate Change and Human Health and create that evidence, and evidence that will change the policy, and evidence that will also lead to electoral voice. So all of that requires to be done together in a synergized manner. Thank you.
Thank you, Dr. Akash. And ladies and gentlemen, what a phenomenal synergy my 5 panelists from diverse backgrounds have created in this, where we are talking in terms of what do we need to move ahead. Well, my last and final question, requesting everyone to just give me a 10-second response. If you were to raise your expectations and assurances to organizations like Lung Care Foundation and Doctors for Clean Air program, what could be your expectations for times to come, please? Dr. Akash, and let's move forward again.
Well, my expectations will be for organizations such as Lung Care Foundation that they help in bringing this message clearly to all doctors, that the doctors are the flag bearers of health, and therefore if we have to make a change in air pollution and health, doctors will have to take a lead.
So you must become the change you want to see. Fabulous. And so we are taking your assurance also in terms of helping us through. Mugdha, quickly.
Not expectation, but my humble submission, given that everyone here is much more qualified, maybe not you, Prabhat, but you'll get there, is that, we are seeing the world's best practice example here in this program, but my humble submission is to continue this effort because you are our educators, role models, and change makers. Thank you.
Wonderful. And we will continue when you are supporting us consistently and giving us a pat on the back also. Manjeet.
Okay, I would kind of say that not again expectation, but again a submission is, let's make the benefits visible. The benefits of clean air has to be kind of more visible. And although there's no bigger benefit than your own good health, but clean air certainly comes with much more than that. Lower air pollution levels also means less damage to the health of the ecosystems and also the health of the economy. We have been kind of saying about we have surpassed UK, we may kind of become the 3rd largest. If we have to move that track, air pollution has to be mitigated. And I think that's where the visibility in all fields has to kind of come on.
Creating visibility is very vital.
Yes.
Thank you so much. Sanjay, how do you look at it in the 10 seconds per window?
Good health is the first line of defense against climate impacts. So my expectation from health professional is that please play a robust and a very active role in minimizing and averting the impact of air pollution, strengthening the resilience against climate change, while also responding, which we all are doing.
Wonderful. Prabhat, everyone looks towards the future and therefore you come into the center stage. So when you are leading for the future, how do you look at it in 10 seconds perspective, please?
Sir, I look at it with a perspective that advocacy and action begins right here. It begins with capacity building. For us, the students who are still in the learning process, it begins right with our formal, non-formal and informal education processes that we learn about all these things. We are made aware of all these things. We are made aware of all the protocols. And ultimately, we are the ones who are given the baton to take the whole race forward.
Wonderful, Prabhat. Thank you so much. This was a wonderful Doctor for Clean Air Conclave panel discussion, which just now happened, DFCA. And if I were to conclude, I will only use 4 words to conclude in terms of our action plan. 1, D, deliver. Deliver on commitment and the promises. F, foster awareness and awakening, igniting the learning amongst all people. C, co-create. Come together, think together, work together. And A, accelerate, pace up, break your own records consistently, deliver, foster, co-create, accelerate, DFCA. And this concludes our panel discussion. Thank you so much. And my panelists do deserve a big round of applause. Thank you so much, everyone, please. Abhishek.
Thank you so much, Mr. Rajiv. Thank you for that wonderful session, and thank you to all the panelists. We have a small change, so we are having Ms. Aarti Khosla first, whose session is on how to engage with print and electronic media. Sorry, just a second. Ms. Aarti is the founder of Climate Trends, and she has over 20 years of experience working on various communication efforts across environment sector and FMCGs. She has dedicated the last 2 years to advance the discourse on climate change in India. She holds an MBA in marketing from Institute of Management Studies and an undergraduate degree in zoology from Delhi University. We are excited for your session, Aarti, on how doctors can engage with print and electronic media. Thank you so much for joining us.
Thanks very much, Abhishek. Very good afternoon to everyone present here, and thanks, Dr. Kumar, for including me. I'll keep it brief. We've run against time. Is somebody going to put my presentation up, or should I just stop?
Yes, Carmen Mithali.
All right. Yes, meanwhile, I will just say that greetings from Singapore. Only when you are out, you realize how much clean air is a determinant to a day-to-day quality of life, and you know how much we as Indians have been living in a compromised state for so long. Having said that, I will just talk a little bit about what has happened in the last couple of years, especially in how media has played a role in being such a determinant of the air quality campaign that has shaped up in the country. I have a few things to say, and as the slides come up, you know, we can go through them. But the first of them is the fact that in the last 5 years, you have seen that media has played a role of a catalyst, of an accelerator, an advocate, a campaigner, and an influencer. That's not small. Let me explain. Few years back, the first time the report started to get filed, WHO analysis came out. Delhi was the most polluted city. That was the time we, as a group which is specialized in strategic communications, started to reach out to journalists to file stories on the state of air pollution. And that is when media started to really take the role of the campaigner. The first campaign, so to say, was by Indian Express called Death by Breath. And then Times of India launched its campaign, which was called Let Delhi Breathe. And then there was no looking back after that. I think NDTV picked up in a very big way. And I think it was the winter of 2017, if I'm right, where Dr. Arvind Kumar with many other senior doctors in white coats in the backdrop of India Gate giving that statement that Delhi is in a medical emergency. I think these kind of activities have really, next slide please, these kind of actions that media has been able to take up suo moto have really helped mainstream the debate on air quality. The problem is, next slide please, the problem is that the debate really was focused more on Delhi, north of India, as well as the Indo-Gangetic plains. And in my view, especially in the work that we have done, just working with media in the last couple of years, mostly trying to make sure that air quality is not a Delhi problem. It is not a summer, it's not a winter problem. It's a problem throughout the year. And it's not just a problem which is limited to PM 2.5 and 10. There are also a multitude of other factors which are in the mix, is something that media has picked up as we go along. Mithali, just to check, should I share my presentation myself?
Aarti, I think she's having some challenge. If you could share it. Sorry. Or yeah, and I think they've got it now. Yes.
No problem. It's okay.
Sorry about that.
No problem. And the second point that I wanted to make was the way some of the court decisions were based on reports that were filed by journalists and judges took suo motu cognizance in the initial days, and I'm talking of the last 3 or 4 years and probably around 2017, 18, at least was very important in benchmarking the problem, which did not exist before that. Health, and especially for this session, because we are talking about it, and because my organization, Climate Trends, has worked along a range of issues and a range of organizations amplifying the message on health, my simple learning has been that in the end, there is huge interest both among the public as well as among the media in anything that links air pollution and its impacts on public health. Even if it's correlation, there was interest before. If we can establish causation, there is even further interest. In the initial years of reporting, when the air pollution campaign picked up in India, and I'm talking only 2015 onwards, a lot of coverage that journalists used to do was largely around respiratory impacts or skin disorders and those kind of obvious parameters where air pollution will impact first. Over the last 1 or 2 years, with the kind of studies that this group has done, with the kind of analysis that has come out, I am seeing now, even if we give a study which talks about prevalence of anemia in India and how it is linked to air pollution as a problem, even that gets picked up. And I think that has progressed just in terms of how the understanding of media has widened. I'd also say another point here, especially when we are talking about health and the role of media, I have also seen media playing a fairly significant role in linking the both to political decision makers. So just as an example, about a month or 2 back, we held a conversation of this nature in Calcutta, where we did a study of 1,500 people across rural and urban parts of West Bengal, trying to show how the impacts are of long-term and short-term air pollution exposure on respiratory systems. And sir, I'll keep it brief, but I think the point that came out was that both urban and rural are impacted, but urban are impacted more in the lower respiratory, which is far more severe than upper respiratory. And to establish this further, we invited the representatives of TMC, the party in West Bengal, and made sure that the minister who handles urban development, climate change, solar, the 2 representatives, the state ministers, were present. That, in my view, has been important really to establish some kind of activity so that politicians also realize that while you cannot directly attribute air quality to somebody dying, but there is a lot of implication and impact which cannot be overlooked. And therefore, I think bringing that nuance into the discussion, you still might have a junior minister of environment saying that nobody dies due to air pollution, but I think we've come a long way with the politicians acknowledging the scale of the problem, and that itself is crucial. Okay, now the slides are going faster than me, but that's all right. You can go to the next one. It was a good slide, and I wanted to talk a little bit about the role of media also in using data journalism. And I think what I'm putting here is a very small experiment that we did along with the Lung Care Foundation, and just as a way to show to other partners and participants here on what is possible. This actually utilizes citizen science and the power of low-cost sensors, where we put low-cost sensors with school children across various socioeconomic backgrounds, and the results that were out were covered by media widely. But basically, as you can imagine, the point really was that there is a time in the day, which is essentially nighttime, where you have children from posh neighborhoods in a slightly better environment because they are living in air-conditioned and air-purified rooms. But throughout the day, when they're going to the schools, they're on the road, they are in the schools. Even those who are going to air-conditioned schools had still a high degree of exposure, and that in and of itself is quite an equalizer in how the problem of air pollution is. And we also realized through a lot of media stats that we have done that somehow the health of children is more important to readers, and that's of paramount interest to them. And whatever we can do to build a better case there is important. Next slide, please. Yeah, and I think this is mostly to let you know the power of media. I've said this already before, but this is mostly to reiterate that in the end, the nuance that has been brought in the conversation, that it's not just PM 2.5 and PM 10. You can go through India's Clean Air Tracker, a tool that we have built, which actually gives you air quality monitoring across the country from 2017 till the day before. And over there, you will find the entire months of July and August, PM 2.5 in Delhi is green. So the heat map will show you everything green. The problem is that even within those months, the AQI index is not within satisfactory limits. So there is more that is contributing to the problem as well. And it's not just the particulates anymore. On some days, it's nitrogen dioxide, which is due to transport. On some days, it's ozone, which is due to secondary formation, so on and so forth. And I believe that if that is the level of journalism uptake that air pollution is seeing, then indeed it is quite a lift from where it was a couple of years ago. And it's actually played a fairly significant role. You can say that a part of the problem is that this is mostly English media. Part of the problem is that it is very Delhi-centric, and I think I will take that. But I will also say that there are lots of examples, and there were some slides before in Hindi. There are lots of examples where across big Hindi readership in UP, Madhya Pradesh, Rajasthan, as well, there are cases, where air quality index itself has been popularized. Thanks for jumping. Indeed, this slide, about 5 years back, we put 5 low-cost monitors, as you see on the left, in the city of Varanasi, and that time it was NDA government's, the government's first term, and Varanasi was Prime Minister's constituency. We mostly wanted to establish that while the debate in 2017 was in Delhi, the problem is in other cities as well. And we found out that in Varanasi, air was more polluted than Delhi. And then we worked with media to talk about how air in the cities of UP is very severe in the winter months. And journalists got interested themselves and actually put a little monitor in their bureau offices, and every day till now have the air quality index in page 2 of their newspapers. It's a very small thing. It does not take too much resource. It does not take too much commitment from the editor and the newsroom, but it makes a very important point that along with the weather report every day, we also have a little air quality report. And over a period of 4 years, it has started to make sense. We've done this in Lucknow, we've done this in Agra, and I think Kanpur or one other city where newspaper bureaus have started to put a low-cost sensor on their office, and it's very simple to keep. And they have just taken the readings and they have matched the readings with the regulatory monitors and try to put the, the regulatory readings out in the press for public to read. So I think these, I know we are rushing against time. These are the kind of things which in my view have been important. I'll leave the rest of the presentation for you all to go through if it can be shared later. But I think 3-4 points that I will make in rapid fire mostly will be that few things where air quality narrative has gained with the involvement of media. Number one, the use of data and analysis so that there is no narrative alone, but these are hard facts and numbers. It's happened in monitoring and it's also happened in health. Establishing mainstreaming the issue so that it is not a ping pong. For example, stubble burning, huge issue. It's not a Punjab problem. We held those media workshops around 4 years back now and trying to look at a solutions-oriented approach to stubble burning. I think the third point, that air quality is not a matter of cities alone, like we had the non-attainment cities in the National Clean Air Program. It's more a question of an airshed approach, a regional air quality management approach, a science-based policy making approach, all of which we see in the Commission on Air Quality Management, and is also the theme of today's seminar as well as the International Clean Air Day. We share the air. So I think the airshed approach, as it was technically called, translating into we share the air, has been something that Indian media has done. And I think last of all, the way they have tried to report on public health, there is always more to be done, but I think on that the glass is half full, half empty. I'd like to appreciate especially the way some of the health reporters have done long form stories, used data, visualization, and tried to really make a mark in terms of how the Ministry of Environment, the Ministry of Health, the Ministry of urban and housing development, which actually holds the Finance Commission budget, have been able to look at the whole scene. In the end, I will only say that improvements in public health will be the only real metrics for whether we have made any progress on air quality or not. Right now, we are slightly far, but I think we are committed to keep going close. And like somebody said, India has made big targets in the climate realm as well, and we work very closely on the climate issues. I think in the end that will be even Indian government's only option to provide eventually a better quality of life, which not just gives air quality gains, also meets climate targets, and is the only way for sustainable development. I'll pause.
Thank you so much, Aarti. Thank you so much for sharing the updates from media and how health professionals can engage with media to highlight the importance for clean air. We would now like to move to the next session and invite Tamsil Hussain. Tamsil is the founder and CEO of multi-award winning platform Plug.tv and Let Me Breathe. He has been using storytelling and technology to enable newer virtual narratives and behavior change. Let Me Breathe is a global climate change and sustainability storytelling platform powered by thousands of creators and communities in countries like India, Indonesia, Nigeria, to name a few. Plug.tv is a B2B2C creator economy platform that enables anyone to learn, produce, and monetize stories early. It works with over 30,000 creators across 22 countries and 12 languages. Tamsil has over 15 years of experience working with global tech companies. Tamsil, thank you for joining us, and we look forward to your talk on leveraging the power of social media and videos.
Thank you so much, Abhishek. And it was so amazing to hear all these amazing panels. I'm really obliged to be here. And it's amazing. I want to thank Lung Care Foundation for actually organizing this conclave. But what I want to do is today, I want to explain quickly. Shubham, if we can move to the next slide quickly. I have Shubham, who heads our creator relations, with us. A quick thing about the biggest takeaway that you can have here in the next 8 minutes, right? The platforms we run really build storytelling communities, right? Right from health, the health storytelling communities include some of the biggest doctors, some of the most specialized doctors, frontline workers, ambulance drivers, ASHA workers who come together to really create amazing stories that transcend through social media and build amazing trust amongst people who are wanting to share it. Environment storytelling is one of the biggest things we do as well, and gender is something that we're starting, right? And really growing into it. And just imagine, from a perspective in the next 8 minutes, I can talk about how you need to use social media. Our experience with social media has been, out of the 32,000 creators we have 3,000 creators who are health professionals. What does that mean, right? When you're a doctor, you actually start your clinical practice to basically help people. We're in a world, and especially in the last 3.5 years, the world has changed transformatively, where more and more people are seeking health support online. And it's not just me who's saying it. The data that actually suggests on Google, more and more people want information, because there's a big behavior change that has happened during the pandemic, right? Where the most credible information you were getting was not from your family, friends, or your doctor, because everybody was so busy, you were getting it through social media. So I want to give you one quick 10-second clip of one of my favorite creators, who is Dr. Arvind Kumar, who's obviously a founder. This video goes viral every year on air pollution. And this is one of the most amazing things we've done with Lung Care Foundation, but we don't push this. This organically grows viral, right? Shubham, over to you. Oh, okay, we can't hear audio, Shubham.
One issue that we used to see a couple of decades back, we found one-to-one distribution. So we had almost as many non-smokers in our study as the smokers, but that was one starting finding. And we found that we had many cases in 20s, which was something unheard of 30 years back. We looked at many reports of the last 4 or 5 decades.
Okay, we can move to the next one. So if you notice, there's something very peculiar about the story, which every social media algorithm wants to pick up. Everyone wants to know more information, especially when they're hit with a crisis and they say, see air pollution outside. And why is this happening, right? Let's look at the data. About 448 million people in India were active social media users in 2021. By 2040, it's predicted to be 1.5 billion internet users. That's way more than we've ever imagined. And if you look at it, only the 0.01% people on the internet are able to influence. When I say influence, these are your lifestyle influencers, these are your comedians, these are people who have millions and millions of followings. But there's a massive trend which is built up in the last two to 3 years where you have individuals and experts and doctors like you who started creating content and building influence. How that helps you is, one, it helps you establish your virtual clinics. It helps you get other financial resources as well. But secondly, it helps you help people by creating amazing, credible content and reduce misinformation. Because 83% of the adult users search for health information and they can't find credible information from the noise that they actually hear. Telehealth has increased by 38% in India, and it's growing rapidly as we speak. And this is exactly, if you go on the next thing, and these are some of the trends, Shivam, these are some of the trends what we've taken from all the social media sites, right? And the biggest thing missing right now is that there's no connection between health and solutions, because most of the reports and the posts that you see is, oh, this you should not eat. You don't know if it's factual or incorrect. Air pollution can do this. You don't know if it's shared by a credible person. This is exactly why your stories are important, right? Let's take another quick 10-second clip from this award-winning show called COVID Hero Project, where you had this ecosystem who combined to tell these stories. Yeah.
मॉडरेट डिजीज किसको कहते हैं और सिवियर डिजीज किसको कहते हैं? मिनिस्ट्री ऑफ हेल्थ फैमिली वेलफेयर की तरफ से वैक्सीनेशन पॉलिसी को लेके कुछ पॉइंट्स सामने आए हैं. Early detection is a key thing. Earlier you detect more.
Now, one of the things that is common in these stories is that these stories, you see health workers, doctors coming together and showcasing action, which wants you to literally take action as well, right? Stories that lead to action are the most powerful things. But what creates behavior change? Stories that include data, right? It leads to authenticity. We saw during COVID that actually a lot of misinformation went down when doctors were sharing stories and posts. But what happens is most of the social media algorithms and most of the people, the way they use social media are driven by algorithms. What real authentic stories do is helps you drive real stories and reach out to more people. Most of the information you see around health and social media or environment is leading to despair. This helps build radical hope. And most of the things you see are created for viral moments, right? But consistent storytelling, which is what we're actually asking people to do, helps you build a movement where people consistently change behavior and are able to also become leaders themselves when they watch your stories, right? Shivan, can you go on the next slide? So here's an example of a script that was written by doctors, right, along with us and a lot of experts, and performed by children who don't even have access to a mobile phone. And it's a fiction story.
So there is some glitch, I think.
Okay, so I'll move on to the next one. We'll share the link of the story. In the last 2 years, we've seen a lot of health experts become creators. What that means is they have their own social media channels. They're using some of the most unique apps to reach out in localized languages, build their own communities, find opportunities with various people to collaborate. It could be government, it could be private enterprise, it could be nonprofits, and they've been able to create a transformational change. And these are some of the examples that you can see on a lot of social media platforms already existing. Another tip that I wanted to give you is after COVID, where everybody's only sharing information on COVID, we've seen those communities transform into tuberculosis. We've seen those communities transform into HIV. We've seen those communities share information on various respiratory diseases, and they're building hyperlocal micro communities. Some of the stories that you can actually tell to really, really take advantage of social media algorithms is short form video, which is going really, really popular right now. Long form video, which stays on the internet. One of the videos that you saw of Dr. Arvind Kumar comes under the short form, long form bit, but it uses some of the best mechanisms of social media that helps you believe that the video is true and you want to share it more. Tweets, stories, which stay for 24 seconds, 24 hours. One of the biggest things for health experts that has come up during the pandemic and is growing rapidly across the world is podcasts, because people come back to those podcasts over and over to know what diseases they're getting and how can they solve the bigger action. And some of the biggest podcasts, we can share a link of list of links with you, which will actually help you do this. Live is a tool which is used by some of the biggest regional apps and social media platforms where doctors are addressing patients live, and it's really, really changing the way people consume content. So if you're getting started on social media, here's a quick tip. The must-have platforms for you are Twitter, Facebook, Instagram, Snapchat. Why? Because you get the youngest, oldest audience there who can actually connect with you on your issue. The second and the most missed out platforms that you actually see in India are ShareChat, Moj, Public, Daily Hunt, Josh, and a lot of regional platforms where people from the most vulnerable groups who speak in local languages access these platforms to literally create and at the same time consume content and share content. And you get direct access to WhatsApp groups, which really helps people travel, make sure their messages are traveling. And one of the things, if I ask you one simple question, what's common between climate change misinformation and COVID misinformation? Do you see a pattern? Yes, no, anyone wants to quickly answer that? It's pretty much the same mechanism, right? You see a provocative post and you want to share it, and there is no response that comes in from it except more and more people without verifying sharing it, right? And one of the biggest things that our storytellers and the creators that we work with is how to fact check, right? So imagine 32,000 people know how to verify information. And the 4 steps to do that is, first and the most important thing is to check the source, right? And if you're a credible authority or expert, a lot of times it's very difficult to know if the source is right from that information. And the beauty about health creators is that there's so much authenticity and knowledge that's already existing, it becomes easier to fact check as well. And the simple thing that you can always ask if you've received a post or received a video or received any text is to ask people what the source of this is. And most of the behaviors you will see is that they would ask their friends, saying, what's the source of this? And people would end up finding that it's fake news. Verify, there's a lot of tools on the internet provided by Google, Facebook, various platforms where you can easily verify right from images, text, media hits to videos on how to verify this information, and it automatically tells you the date, time, when it was done, and if it's fake or not. And you can analyze the evidence, because a lot of time disinformation is something that spreads even more, where people are messaging things in a certain way which actually reaches out to different people, right? And this is where health, like the knowledge of a health creator, comes in, where you can actually talk about an issue in a very clear way. And it's very important to not share until it's verified, right? There are various tools for you to report it. At the same time, what we usually have a habit of doing is that we share information because we want to react to it without knowing what the truth behind it is, right? Because we are angry that it's fake news. But what it's actually doing is it's also spreading the fake news around it as well. So one of the biggest tools that you need to start your journey on social media is very simple. It's a mobile phone. And what a mobile phone does is it gives you a camera where you can just simply record your first video. It could start off by saying that, hi, my name is this, I'm located over here, and this is what the issue is. The second you can try adding is how you can find a solution for that issue. Since we're talking about air pollution, we have on 7th September, we have Clean Air Day coming in, where us, along with a lot of organizations, will be amplifying stories on clean air every day. So there's a massive need for health creators to be able to tell those stories. So if you're thinking of taking your first step on social media, this is a great moment. Simply write a tweet or make a video and put it up on any platform, and you will see UN and right from the biggest organizations sharing it. If we can move to the next one, Shubham. Right, I think if I'm quickly recapping the hurried presentation, each and every part of this slide is a different workshop module that we conduct with various doctors. The doctors who participated in our trainings range from ICMR to IPA to various organizations who really want to know how they can use social media to make sure that it can benefit various people, and at the same time, the word can reach out. The first and the most important thing in 2022 on social media is authentic voice. It doesn't mean you create on an algorithm. It doesn't mean you create on a trend. It means you create authentic content. And if you do it, people will listen to it. The diversity of content becomes very important. If you're just simply sitting on a table and chair and you're creating a story, it might reach out the first time, it might not reach out the second time. One of the most viral videos that was shared by the Ministry of Health during COVID was of Dr. Naveen Thakur, who was on a cycle after getting his first vaccine jab. And he was saying, I'm completely fine. Right? And that's the power. People want to see action. And these are innovations you can add and not just talk about one disease, which is your specialty, but talk about various issues that can connect to it. This will help you build a community. When you're launching a campaign, you will see more and more people participating in a very powerful way. Let's not forget that putting your face to the data that exists is very important, because it helps people believe you virtually, right? It helps people say, oh, this is a credible person sharing information beyond the titles, and they want to connect with you. And we've seen some of the biggest influencers who are online, who are doctors, use this technique in such a beautiful way. And the power of influence, let's not forget the power of influence. A power of influence is not just a quick trend and you become really famous, right? The power of influence starts with a small group of people who believe the content that you're doing. They will share it with 10 other people. It starts hyper-local, goes local, then goes national, and then goes global. It's a long process, but the beauty of it is while you're building that process, there's so many opportunities that come in for you to connect, collaborate with some of the biggest organizations. And a lot of us are on this panel right now. Organic reach, a lot of times we are worried that if we can actually reach out to people organically, because of the multiple platforms that have opened up in India, and this is what's unique about India than any other country, we have regional platforms. The organic reach has become much easier to reach the most corner part of the country if you have content that connects with them in that local language. Tell stories consistently, which will help you build a community and build a movement of your own on the issue that you really want to do. Yeah, I think I just wanted to quickly sum it up, Abhishek. I had a different presentation, so I shortened it. The first thing, let's forget, I think the most important thing is to democratize the creator economy. When I'm talking about the creator economy, is there are a lot of people who don't just use social media to share information anymore. Social media is a business for a lot of people and a community for a lot of people, and you can form it on your own. Most of the doctors who are creators with Plug TV have formed their virtual clinics as well, right? And it's a beautiful marriage of both things about the issue you believe in and at the same time the business you want to run. So now social media can contribute to the things that you can connect with as well. I'm sorry I'm taking a different approach, but I've seen that it works with a lot of health conclaves and people are just doing amazing work on social media. Yeah, that's about it for me, Abhishek.
Thank you so much, Tamsil. Thank you for that very informative and fast presentation. Sorry that we gave you such short time and also reduced the time. But we will be reaching out to you for doing a more detailed session on this. Going on to the next session, we have success stories from Clean Air champions across India. These Clean Air champions got associated with us in 2018 when we launched Doctors for Clean Air, and they have done some phenomenal work since then. I'm delighted to invite Ms. Shweta Narayan to lead the next session. Shweta is the Global Climate and Health Campaigner at Healthcare Without Harm, exploring intersectionality between climate and health, working with health sector on climate action. She has worked as advisor for Healthy Energy Initiative India, as well as coordinator in community environmental monitoring. Shweta is also one of the key advisors for Doctors for Clean Air and Lung Care Foundation work, and was involved in the thought process of formation of Doctors for Clean Air. She has a phenomenal TED Talk, which went viral within few days of getting released, and I will share that in the chat during the session. Over to you, Shweta.
Thank you, Abhishek, and good afternoon, everyone. Thank you so much for organizing this conclave. It's an absolutely essential part of the discourse on air pollution, and especially when it comes to health professionals and their role. Since morning, I think we've gotten so much information on health impacts of air pollution, the different streams of medical profession and their leadership, and how we tend to take this information forward, and what do we do next in terms of advancing the discourse on preventive healthcare rather than just curative healthcare. And in the earlier panel, it was very interesting and a rapid fire panel. But one thing that we sort of ended that panel with was an imagination of what the role of health professionals in the future would be like. Now, in this panel, we're going to give you that glimpse of that future that's happening with us right now, just to learn from the different solutions that health professionals are leading with. And also the idea is to inspire those who are who feel like we have a lot of information, but we don't know how do we go about it. And this session showcases 5 clean air champions. We have many, but at this point, because of the paucity of time, we're just showcasing 5, and their leadership in advancing the conversation around clean air and better health. My first panelist for this session is Dr. Shivakant Mishra, who is the Chief Consultant Surgeon and Director and CEO of Shivani Hospital in Kanpur. And welcome, Dr. Mishra. And I hand over the panel to you to talk about some of the Clean Air success stories and your experience as a health professional in advancing the stories, and how do you see them shaping up in your city and in your area of intervention.
Dr. Mishra, unmute yourself, please.
Thank you, Shweta. In fact, at the outset, I would like to thank organizers and Lung Care Foundation, especially Professor Arvind, for allowing me to give my insight about the whatever we have achieved as a Doctors for Clean Air. The session this morning has been so absorbing, and it has been so good that it was hardly as though 3 hours have passed, and so many other commitments are there, but I could not leave the place. It was really, really very much illuminating. And I start with a share like घोल कर जहर हवाओं में हर शख्स मुंह छुपाए फिरता है. Inspired by my friend Professor Arvind Kumar, I joined DFCA, that is Doctors for Clean Air, on 4th December 2018. As a busy practitioner, I had, I would say, not much idea or interest in the environment or the air pollution. Then it was the magic or charisma of Professor Arvind Kumar, Abhishek and Rajiv that sucked me into Doctors for Clean Air. And you all know that Uttar Pradesh has got a dubious distinction of having many cities amongst top 10 most polluted cities of the country. And Kanpur, which the city which is my city, I'm not so proud to say that it often tops the list. And as has been initially told by Professor Arvind, that the purpose of DFCA has been the awareness, awakening, and actions. So there was something, not if I would say too much, but certainly we have made a difference in the society. And the next few, it is very small, just glimpse, because visuals, they give more impact. That see, we have been able to engage public largely, I would say the schools, teachers, parents, and doctors, then business people, the chartered accountants, the advocates, and most important, the policy makers, the politicians, and the bureaucrats, which was, I think, very, very important to make them aware by various means. And I would say it was so heartening and so good to involve the school children in the form of the workshop, and the parents and the teachers, which really made a large impact on the society. And we have done few awareness programs and the workshops, and the latest was at IIT with the IIT Kanpur, where along with the leading business houses, industries, the key officials, doctors, the commissioner himself participated and was the played a key role. And he is still there. And I can see when somebody, a head of the family who can make difference, if they get involved, really, I think we can achieve what we wish to achieve. And it was all the good effort and awareness. And let me tell my audience today that now we are very active group of, I think, people who at least talk about this, and very many are implementing all those visible changes in their own organizations with their own employees. And that is what we have been able to. The political engagement, as I said, it is very, very important. So involving the minister, involving the mayor, involving even local corporator, because ultimately they are the people who will see that, yes, air pollution is a big problem and that has to be tackled. So that was where we have been successful. And I know with the member of parliament, the MLAs and the ministers, the municipal corporation, now everyone knows about today's program and everyone is aware, and that is where our success lies. And as it has been discussed, the media plays an important role, and all those programs are being covered, and the message goes not only in the urban areas, but in the rural areas as well. And by this way of communication, people get aware and they talk about, and then they demand and they also contribute for the betterment of the environment. So that has been, I would say, in nutshell, whatever we could achieve, even not only through the physical meetings, but the virtual meetings like today it's happening. And I must compliment, today's meeting has been phenomenal in that direction. And a little bit about Kanpur, how Kanpur has changed in last couple of years, though it has got a distinction of being sometime most polluted city in the country. But as far as these things are concerned, now things are happening towards good. And as a basic Kanpurite and from the Uttar Pradesh, I feel happy and proud that yes, now the things are changing, though it needs, I think, a better pace, but I am sure that with kind of involvement that government, policymakers, public, everybody is involved. So that is what now, as far as the cleanliness is concerned, it has come on 25th rank from 63rd spot in the survey of 2020. And I'm pretty sure that 2020 will yield a better result. So now we see a lot many changes in the form of metro rail, the e-buses, e-rickshaws, so all these things, and also happening encroachment removal, the better garbage management. So these are the changes which we are perceiving, though it may look still very minimal, but we are heading the right direction. So I'm very positive, and I am always a positive person, and I'm very hopeful that future is ours. And that is how I feel happy and confident that DFSA has made large impact on the society and the policymakers towards awareness, awakening, as well as certain concrete actions to have a cleaner air and good environment. Thank you very much.
Thank you, Dr. Shivakant Mishra. It was indeed very inspiring, and it also helped us sort of actually visualize what the intervention at various levels and how effective they can go in. I mean, they can be in the long term. I recognize we have 5 panelists today, including Dr. Shivakant Mishra, and we have doctors who are super busy. So I'm going to invite our next champion, Clean Air champion from Madhya Pradesh, Dr. Salil Bhargava, who is the professor and head of My apologies. I think my internet was a little distinct. Professor Salil Bhargava, welcome, sir. Just a quick line of introduction. I think I was midway introducing you and my internet sort of gave way. Professor Bhargava is the professor and head of Department of Pulmonology in MGM College, Indore, and our Clean Air champion from Madhya Pradesh. So the floor is yours.
Thank you. Thank you very much. Thank you, the whole Doctors for Clean Air and Lung Care Foundation, and Professor Arvind Kumar, who has been taking the lead so nicely across the country, and for inviting me here. You can see me, I'm sitting below a tree to talk to you. And in fact, my job is slightly easier as compared to rest of the country, because Indore has been at a length 5th time the cleanest city of the country. And what I understand, if you work for making a city clean, then everything goes automatically to its own pace. The pollution has certainly to go down because rest of the things are also going down. And people are very much aware about so many things. They don't throw the garbage here and there. The vehicles, they are well maintained up to some extent. We are using a lot of electrical vehicles here. So whatever the reasons are for creating air pollution, they are automatically controlled when you work in toto for making a city clean. As I told you, we are at a row, at a stretch, at a row. We are fifth time, and this time is the sixth one. It will be. But apart from this, we have been working at various platforms, because what I feel, you should move from where to the next step. I've been talking to our municipal corporation mayor. Can we make it a place where international people and the international society can come and look what are the practices, best practices? Here we have been managing the garbage and other thing very nicely. People throughout the country, they come here and see how we have been disposing the waste and the garbages. And we have organized a World Pneumonia Day, in which we invited the doctors, media, school children, and on that day we had a talk on air pollution and other things. Simultaneously, I am working with a group which is called Clean Air Catalyst, to which I was connected through Doctors for Clean Air. They are working in two countries, two cities only, Indore and Jakarta, for making it better, less polluted cities and a better city also. In that, we have been talking to different group of persons, and in last 1 year, we have been trying to gather the data, which are the problems which make more pollution, which are the conditions. So we have collected the data about that. And in fact, when we have been talking to automobile industries persons, we have been talking to the hotel industry, we have talked to doctors, we have talked to media, school children, the health workers in the field. We have been talking to all of them in different groups, and we have collected the data which tells us which are the common problems in the city creating more pollution. And now in the next year, second year, we will be working on fixing up top 2 or top 3 problems. And majority of them have come in the way of, in the form of the factories which are creating more pollution. We have a lot of dal mill here, which is creating air pollution. So we are trying to fix them up gradually. The media has also become very alert here, and they have been talking to us. Honestly, we have seen one of the days where there was very minimal pollution, air pollution was there. So what I feel, that if you make your city clean, then everything you get in your hand, and you can make your city better and less polluted. Thank you very much again, the team, for inviting me here. I'm sorry, I'm on a outdoor platform, so I don't know whether my voice and other things are okay or not. Thank you very much.
Thank you, Dr. Bhargava. Your voice was absolutely perfect, and so was your message and your lessons that you have shared from your local intervention. It's really inspiring. And I mean, I wish we had more time to have some more discussion, but I'm sure we'll find some time in the future to talk more and do a deep dive in this. Sure. My next Clean Air champion is a Clean Air champion from Assam and Northeast, Dr. Rashna Hazarika, who is a pediatrician and at RIGPA Children Clinic in Guwahati. Dr. Rashna, very warm welcome to you. And I know you have a really busy schedule, so I'm not going to take any much more of your time, but I would like to hear from you your success story and your experience, which could possibly also inspire other doctors at this platform over here. Welcome, Dr. Rashna.
Thank you, Shweta. Thank you, Dr. Arvind Kumar, for the invitation. First of all, I think we went off with a big bang a few years back before the pandemic, when we did our meeting here and for sensitization of all the doctors. And post that, what I must say that the pandemic came in and we have taken a back seat now. So nothing much has happened as far as propagation of this message is concerned, excepting what has been the good thing is that many of our members who attended the meeting, I think it was in 2018, They have been continuously writing, articles in the newspapers, local languages, trying to give the message to the government and the public on why clean air is important for us. The problems are many in my part of the country, and because we have very often, we tend to ignore it because we have a nice rains out here most of the time, and the air gets, cleaned off of all the pollutants. But the issue is that the garbage collection is not very good. People are still burning a lot of household waste, and the awareness level is still low. So I think we have a long way to go. And many of the doctors, who were in the meeting that time, because of the pandemic, got COVID themselves and had took a long time to recover. So the group has not been very active, frankly speaking. And what we have noticed now is that the incidence of respiratory illnesses has increased drastically in this year, especially. And I think recently we have had many cases of acute asthmas coming in to the hospitals, and some of them very, very sick. Other respiratory illnesses are also increasing. Many could be because of the immune gap which they had for the 2 years, which they never went out of the house and were not exposed to anything, neither the pollutants nor the viruses. And then now again, when they've started school, we are getting all these illnesses. So we have a lot of work to do now again, and I hope that I can get together with Lung Care Foundation and restart our efforts to improve the air quality in this part of the country. Thank you so much. I'm actually now in Bangalore attending an advanced asthma course because our children are getting more sick and they're not responding to the usual therapy. So probably not only the therapy, but prevention is very, very important. So I am also associated with the respiratory chapter of the Indian Academy of Pediatrics. And I think this chapter can tie up with Lung Care Foundation and Doctors for Clean Air and make a big, huge difference all across the country. So I will put the message across to the chapter, and I hope, Dr. Arvind, you can connect with the current office bearers of the respiratory chapter. And I think that will be a very good way of going forward and, getting things done. So thank you so much. I will have to now go off. Thank you so much for inviting me.
Thank you, Dr. Rachna Hazarika. And indeed, a very important message where it's important that every stream, every specialization of the health professionals need to sort of come together. And I think one thing that Dr. Rachna did mention about what they are noticing in the hospitals, the data that they are getting is absolutely important. The more we have authentic data from the ground, the more it would be crucial in sort of influencing the right kind of policies and action. So I hope that this continues and we strengthen the effort. My next Clean Air champion in this panel is a Clean Air champion from Andhra Pradesh and Telangana, Dr. Vishnu Rao, who's an eminent pulmonologist, allergy and asthma specialist, and founder of Swasa Hospital and Foundation. Dr. Vishnu Rao, welcome. And please, it'll be great to hear your interventions and the success stories that you have been leading in the region. Welcome.
Actually, I'm suffering with severe pharyngitis. So I'm very happy to participate in this meeting under the visionary leadership of Dr. Arvind Kumar. We have done so many programs in Andhra Pradesh in Telugu states. Recently, we have done one program on behalf of Swasa Foundation Trust, where we invited the health minister. So we had a talk to set up the air quality index throughout the Hyderabad. So health ministry is very dynamic here, and he want to participate us in this air quality index so that Hyderabadis will be known what is the quality of air on day-to-day basis. So ourselves and Vimta Labs, in association with Lung Care Foundation of India, now we are planning this one. So I think we are going to materialize in a couple of weeks, so which I will inform to Dr. Arvind Kumar So how we have to go about it, and I will take the feedback from him also. So this is the action we are going to take in couple of weeks. Through this, I think people will be aware of the air quality index on day-to-day basis. At least the awareness and the consciousness will be rising in these areas. So particularly on Diwali days, how the pollution is, on festival days, how the pollution is. So all these things we want to implement in this area, since this is the burning topic everywhere in the country, not in the country, everywhere in the globe. So at least we have started the momentum, and I think we will take forward by cooperating each other. I think this is what I wanted to tell, this latest development. Otherwise, we keep on doing the awareness program, particularly whenever I go to media or social media, print or electronic media. First, my talk will be on the air pollution, how it affects the lungs. So the figures which were shown by Dr. Arvind Kumar, I use them for the reference. So how the air quality was there few decades back and how it is now, because seeing is believing. So only people will, then only they will understand. I particularly working on indoor pollution. So right from the, even I am a pediatrician also, pediatric pulmonologist. So I see a lot of cases in asthma. So particularly our practice in rural India or some part of the metros also, after child is born, they subject the baby to this sambrani, a kind of smoke, thinking that evil powers will go, evil spirits will go away. They drench the baby literally in the smoke. And this practice will continue for 2 weeks, 2 to 3 weeks. By that time, they will come with wheezing problem. At the end of 1 month, 2 months, 3 months, less than 3 months only, many babies are coming with the wheezing. So this is actually the other speaker who was talking prior to me. This is a good suggestion that IAP must be tied up to the Lung Care Foundation of India, so that we have to give inputs to all the pediatricians across the country where they are seeing in, day out of the cases. At least we can advise some of the patients as far as indoor pollution is concerned. So these are the things I want to share. Thank you, Dr. Arvind. I'm not able to talk for a long time. Thank you so much.
Thank you, Dr. Vishnu Rao, and it's incredible, and it just shows commitment that despite not being well, you've participated and you've shared your experience. And one thing that I sort of noted while you were talking about especially the initiative of setting up of air quality monitors across Hyderabad, I think this is a very crucial and a much needed step, because unless we know the problem of air pollution, how do we expect us and the citizens to act? And the first step in making the problem real is to sort of share the evidence that there is a problem. And I think this is a phenomenal step led by a trusted health professional. It adds a new dimension to that information, and we wish you all the best, and we hope that this will become a model for rest of the cities and rest of the states to follow in the country. Thank you so much, sir.
Thank you. Thank you. Thank you.
Our last panelist for the session, last but not the least, is Dr. Ruby Makhija. And she's a Dr. Ruby is a practicing ophthalmologist for more than 20 years, and she's a co-founder of Why Waste Wednesdays Foundation on managing the menace of single-use plastic. She's also a brand ambassador for Municipal Corporation of Delhi and member of city-level task force on plastic waste management at the MCD Delhi. Dr. Makhija, a warm welcome to you, and I invite you to share your story of success with the panel today.
Thank you, Shweta ji. Thank you, Dr. Arvind and Lung Care Foundation, Rajiv ji, for having me over. So since I have very little time, so I'll just straight away jump onto whatever a little bit we've done. I'd like to share my experiences if this could help make the city better, make the country better. So I'm an ophthalmologist by profession, and as a matter of chance, I entered into the Resident Welfare Association of my colony. And that was when it was time when MCD was propagating waste management at source, and we took it up on priority. And waste, directly or indirectly, is related to air. We all know why, how, and when. So I'm not going to discuss that. So how we did it, how we created a zero waste model in our colony, I'll discuss that. I'll also discuss what we've done as far as direct air pollution is concerned. So since it can't be a single-handed effort, it was a team effort, and MCD has been extremely cooperative in this. ITC WOW, Wellbeing Out of Waste, and my own NGO, Why Waste Wednesdays, along with Navjeevan RWA, we all work together towards a better environment. So this is what we've achieved. Some of you must have seen our 2 viral videos which are going around about a zero waste model colony where we have attained 100% waste segregation at source, 100% wet waste composting, dry resource segregation. Our Dalao is closed. We're not contributing one bit towards the landfill site. We have a crockery bank, and we've saved more than 30,000 disposables in the last 3 years. We encourage home composting, 9 rainwater harvesting pits. There's a lot more to this, but I'll come straight to what is related directly to air pollution. So as you rightly said, that the first thing is information. So dissipating correct, authentic, credible information was the first thing we started with, educating and communicating to our residents. So there's a broadcast system in my colony whereby I write to all my residents every evening. I have 1,100 residents on my broadcast. And when there's no work in the colony being done, I preach about water, I preach about air, waste, whatever topics. So I share videos. So this is something which was very basic to whatever I've achieved today. It all depended on correct, authentic, credible information. Next was sensitizing our residents, especially children, to environmental and social issues. So how we did it, it's otherwise you call a gathering, there are hardly 4 people. If I tell them that it's on air pollution, nobody would come and attend. So we integrated all our events, all our functions with environmental and social issues. Like if you see the picture here, it's of a Halloween party, pre-COVID, of course, where we collected about 85 children and we went around the colony holding a Halloween parade. But before the parade, since it was winter coming up, we took up air pollution as theme, and I educated all of these children about air pollution, and each child was assigned 4 households in the colony where he had to further go and preach about air pollution and what can we do at an individual level, at a colony level, to curb air pollution, to control air pollution. So as you can see, the placards clearly reading, this was 3 years back we held this parade, and now by God's grace, if COVID is over, we'll continue to hold this every year on Halloween. Then garbage. Now, again, as I said, what happens if we don't segregate our garbage? You can see the Ghazipur landfill site, which is almost reaching Qutub Minar. It creates certainly certain toxic fumes, methane, carbon dioxide. We all know, being doctors, what are the side effects, how it affects the lungs. So I'm not going to discuss that. How we tackled this is something which I'll discuss. So almost nearly 4 years back, we did our homework. We took up waste management on priority. We, for 6 months, studied various models of colonies which had attained internationally a zero waste colony model. And that was when we started. So our IC activities about creating awareness to our residents and our composting went hand in hand. We did door-to-door surveys, we did door-to-door audits in association with IIT Delhi students, in association with ITC WOW, and we came up with this model. After preaching for some time, we told MCD we have to get strict, and it's okay if we issue certain notices. But thankfully, nothing was required. The residents were already so aware. We gave them an option. We handheld them. Their each and every problem was taken care of. Brochures as to what should go where were clearly distributed. Games were conducted on air pollution. Games were conducted on waste management. 3 dustbins, what should go where. Each cards placed at the end of the game. Gifts. So we made it very, very interesting. People participated. We moved on from 100% waste segregation at source to 100% wet waste and green waste composting. We generate almost 10,000 of pure organic compost every year. Dry resource segregation. We have various categories. As you can see, the rickshaw clearly marked with various cartons. We collect e-waste separately, fabric waste separately, plastic waste separately, paper waste separately, glass, metal, all segregated, sent to recyclers. Nothing goes to the landfill side. The sanitary waste is picked up by MCD, goes directly to the incinerator. Dhalau, which was a sore point of the colony, stinking all the time. It has been closed totally. There's no need for Dhalau in our colony now, and we're planning to convert it into a library. So this is our journey. As you can see, nothing, when I say nothing in the last 3 years, has ended up on a landfill site. Children with the parade, community engagement, see how we educate our children. There are quizzes which we hold, there are parades which we hold, there are plantation drives which we hold. Time to time, the entire community becomes a part. It's more of an event than if you can see cartoon characters with children, with adults, of course, pre-COVID time, street plays, puppet shows, senior citizen program where one senior citizen attached to one volunteer who's taking care of all the needs of this senior citizen and also educating them on these issues. This is our free sanitary pad distribution, biodegradable sanitary pad distribution, whereby 175 domestic helps come to us every month to pick up their supplies. That is when we talk about various issues to these women. For the last 3 years, this program is on, and it gives us an opportunity to interact with them, to educate them, to make them also aware, because they are the ones who are running the show. Most of the times residents are aware, but we miss out on this class. We do it for guards, we do it for helpers, we do it for drivers, we do it for each and every person in the colony. And now we've moved on from colony level to a bigger platform whereby as I'm the ambassador for MCD, we've for all these zones, we hold training workshops, awareness workshops, for markets, for educational institutions. Over 1,000 RWAs connected with us. And this, as you can see, the awards and accolades which we have received, of course, is, I can't even put it all here up. So this is about creating a zero waste model. My second project, which is a high impact, very high impact project, is Project Vikalp. Again, the video went viral. Now, Project Vikalp, as a member of city level task force for plastic waste management, I picked up Mehroli Mandi and tried to convert it into a plastic free Mandi. We sat down there every single day for 1 month for hours together to study the pattern as to what is wrong, why people are not able to give up plastic. And that was when Vikalp was born. It is the signature project of my NGO Why Waste Wednesdays in association with MCD. So what we do here is we've converted almost 350 existing shops in Delhi, across Delhi, in all the 12 zones of Delhi, into Vikalp stores. Now, what is Vikalp? Vikalp means an alternative. So what was the reason why people were not able to give up single-use plastic was that there was no alternative at source available, equivalent alternative, which are free of cost. A cloth bag to a plastic bag, if you compare the cost, it's very expensive. Neither the consumer wishes to pay up for the same, nor the shopkeeper. So what do? So we came up with Vikalp, whereby we placed our cloth bags on these 350 now functioning stores, and the consumer can pick up a cloth bag at any point of time across any of these stores, and without a time deadline can return it across any of these 350 stores and take a total refund of 20 rupees. So you pick it up by depositing 20 rupees and you return it across any of these 350 stalls and take a total refund. Now, how do you know where the stalls are existing? So there is a QR code which goes right on the bag on all the promotional material. So when the consumer carries the bag home, scans the code, reaches to the web page of Vikalp, and from there can get the list of entire Vikalp stores that are existing in Delhi and outside Delhi also now. So this is one very impactful project, which if I can say, it started less than a year back and has really taken off very well, loved by the consumers, loved by the environmentalists, and loved by the shopkeepers also, because they save now on plastic bag. And the consumer at the back of his mind knows that he can at any point of time return the bag and take a total refund. And the bags are of extremely high quality. As you can see, I'm involving clubs. Inner Wheel Club District 301, which has 90 clubs under it, are now working with Vikalp. We have self-help groups who are stitching. We are generating livelihoods out of it. These are shops, where shuffle stores, where we are placing all these bags. The shopkeepers are extremely cooperative. We really do a lot of homework before we convert a store into Vikalp store, and then monitor it also after that. Market drives, and these are weekly markets now. The most notorious markets for waste management are also being tackled by us now in association with MCD, because without MCD, we just can't. They are the enforcing agency, they're the policy makers. We really can't move a step without them. As you can see, there is no newspaper, including Gulf Times recently covered us on the special edition of India's Independence Day. It is a huge, I would say, honor for us. The awards say it all. Yesterday we got 2 awards, one for Vikalp and one for our zero waste colony. So what have my lessons from all my work for the past 5 years? The best time to do it is now, and the only way to do it is together. Now, as far as direct air pollution is concerned, strict no open burning allowed in our colony. Lorries are no fire lorries. We just do a small Havan Kund, and not just from today, for the last almost kind of 4 years, we have not burnt an open fire for lorry. We provide heaters, adequate clothing to our guards. This is something which we do at an individual level, and at a colony level, to reduce the vehicular movement on the roads. Whenever it is a function like Karwa Chauth, for example, we call all the chudi walas, all the mehndi walas, even the sweet walas at one point, so that the people don't have to step out of their homes, go out and shop. So that's my journey. There's much more I can talk about, but due to time constraint, I rest it here. Thank you so much for having me over, and please keep your efforts going. It's very difficult, extremely difficult to work. I know it well because I've been doing it for years now, but certainly every single person can make an impact. The only example I can give is one person who adopts one cloth bag saves 500 poly bags every year. So you see, I can actually make an impact. It starts from I. That's all. Thank you.
Thank you, Dr. Ruby Makhija. It was indeed very inspiring to hear about your journey, and it gives me a lot of hope, because recently I was reading about the expansion of the waste to energy plant in Delhi, and that was really disappointing. And given that it contributes so much to air pollution, so just to hear about zero waste work that you've been spearheading gives me a lot of hope. And I hope that these messages would also reach to the policymakers who are inadvertently investing in some of the most polluting solutions. With that, I think this panel will come to an end, and I would like to hand over to Dr. Kumar for the final session. Thank you, sir.
Thank you very much, Shweta, and all the panelists of the last session. Some of you might have got an impression that, well, as far as the DFCA champions are concerned, not much has happened in the last 2 years in terms of demonstrable actions. I would like to highlight the DFCA started in 2018. 2019 was the time when we had our state chapter launches across the country and inspired those people to actually start working in these areas. By the time the chain was set up, COVID came, and 2020 and 21, nothing physical could happen to sort of expand the work, although we remained extremely active on the digital platform during that period and carried out a large number of Zoom and other programs on COVID as well as air pollution and other related issues. We also did a DFCA con involving 7 different associations during that time. But now that we are hopefully coming out of COVID, we are now starting our physical activities together. So probably when we meet for our DFCA con next year, all Clean Air champions will have a lot of demonstrated actual groundbreaking or rather change-making work that they would have carried out in this next 1 year. So now it's time for me to sum up. It's been a wonderful 3.5 or rather 4 hours. We started with the opening session where DFCA material was presented, followed by a talk by Dr. Salvi on health impacts of air pollution, followed by a very powerful presidential panel where 9 presidents gave a message about how they can leverage the power of the associations to achieve the goal of clean air. Dr. Rameshwar from the ministry then narrated in detail the various steps which are being taken by the ministry to reach the information for capacity generation and for making the change. This was followed by a panel discussion where people from the Dr. Akash Srivastava from the ministry, from Clean Air Fund, from Mugda, from WHO, Manjeet, from KENSA, Sanjay, and from MSAI, Dr. Prabhat Jha. They narrated as to how intergroup cooperation could actually lead to fast forwarding of this. This was followed by a presentation by Aarti, how we can leverage the power of media and how media reporting has made a difference in the last few years, followed by another very powerful presentation by Mr. Tamsil on how the social media, especially in regional languages, things which are not even known to a lot of people, but have tremendous reach and tremendous power, how they can be utilized, followed by the last session conducted by Shweta, where Dr. Mishra, Dr. Rashna, Dr. Salil Bhargav, Dr. Vishnun Rao, and Dr. Ruby Makhija highlighted the significant success stories, which are actually very inspiring. So what is the takeaway from all this? The takeaway is very clear. Air pollution is a serious issue. It's the biggest existential threat to human race today. We all need to come together and do something now. The time to act is now. If we let it be postponed to tomorrow or day after, it will be too late and probably we would have missed the bus. What can we do? As was said, awareness is a very crucial step for which the doctor community, as has been highlighted repeatedly since morning, has a very important role to play. And Doctors for Clean Air will continue to work with all these and more associations to reach out this information to people, to see to it that their websites have information, their members are informed, their annual meetings, regional meetings, state chapter meetings have a talk discussion on air pollution. Side by side, we will use the power of media, the power of social media to reach this information to public. So that's part one. Continue to work in the area of increasing the awareness of people on the health impacts. Having made them aware, we'll also suggest to them the measures that they can start taking, as was elegantly pointed out by Dr. Ruby Makhija, that small steps taken by citizens across the country. If 1,400 million people make one step, it becomes 1,400 million steps. So combined action by people, small actions, but collectively, they will have a big role to play. Side by side, I think we need to do research, generate more data and present it to the government, present it to the societies, present it to the courts, so that we have policy changes also occurring. So awareness on one hand, awakening the people towards their individual actions is second plan, and then acting towards making the relevant policy changes done is the third plan. I think if we can make people aware, if we can awaken them to take their individual solutions, my solution to pollution, instead of asking what you have done, if each one of us asks, what have I done? What can I do? I think 1400 million people asking this question will be a big positive development, side by side, supported by policy changes. I think these three things together is the way forward that Doctors for Clean Air and Lung Care Foundation, along with all of you, ladies and gentlemen, alone you can do very little, but together you can even move mountains. So blessed. So believing in this philosophy, we request all of you to continue to be associated with us. We'll reach out to you regularly, and I'm sure if we work together in these three areas, maybe when we meet next year, we will be breathing more clean air than we breathe today. Once again, thank you very much, ladies and gentlemen, to all of you. But before I close, it's my very pleasant duty. I have thanked all the participants, but there is a team in the Lung Care Foundation, starting from the founder trustees, Rajiv, Abhishek, Dr. Bilal, the DFCA team which is working here, Dr. Mitali, Dr. Khamin, Hamid, and other people working in the LCF office, who have been working tirelessly for last so many days for putting this show together. Maybe Rajiv wants to come in on that.
Well, definitely, I would like to.
Tulika, Neha, and Kamla are
Ashokji
there in the office, who have been working with Dr. Khamin, Dr. Mitali, and Hamid, and all of us.
And Dr. Ashokji also. Sorry, Ashokji also has been.
Ashokji provides the mail support to carry out these organizations. So my humble and sincere thanks to all the people working in the LCF office for making this program a success. And ladies and gentlemen, a big thanks to all of you for joining us on this Sunday morning and making this program a success. I'm sure that with your cooperation, we should be able to make a change. Thank you. Have a safe day and a wonderful, pleasant Sunday evening. Goodbye.
Thank you.